Good morning, distinguished guests, Director, CSIR-CFTRI, scientists, faculty, delegates, dear students, ladies and gentlemen. On behalf of CSIR-CFTRI, I am pleased to welcome you all who are present here physically and virtually for the second day of the National Workshop on Initiatives and Progress to Address Hidden Hunger. May I now request Dr. Giridhar Parvatam, Head FSAQCL, to introduce our today's eminent speaker, Dr. Mona Duggal, Director, ICMR, National Institute for Research in Digital Health and Science. Sir, please.
Good morning to all of you. Good morning to all of you. So I welcome you all for the day 2 proceedings of this National Workshop on Hidden Hunger. Today we are going to have the second theme talk going to be delivered by Dr. Mona Duggal, Director of ICMR, National Institute of Digital Health Research. I welcome you, Madam, for CFTRI Mysuru. So now it's my pleasure to introduce Dr. Mona Duggal. Dr. Mona Duggal has obtained her Bachelor of Medicine and Bachelor of Surgery, that is MBBS, in 1990-95 from Lady Hardinge Medical College, University of Delhi, and obtained a MD degree in 1999 in Preventive and Social Medicine from University College of Medical Sciences, University of Delhi. Subsequently, she obtained Master of Health Science in Epidemiology from Johns Hopkins Bloomberg School of Public Health, Baltimore, USA. And later, she availed the fellowship in medical informatics at Yale University of School of Medicine, USA. Subsequently, after returning from the USA, she joined as a senior program officer in Translational Health Science and Technology Institute, Delhi. Then worked in IIT, that is the Indraprastha Institute of Information Technology, as an adjunct professor in 2015, and later on she worked as an assistant professor and associate professor at Postgraduate Institute of Medical Education Research in Chandigarh. Then she assumed very recently in the March as the director of National Institute for Research in Digital Health and Sciences. Madam is having many professional recognitions. She availed the Department of Science and Technology Travel Fellowship in 2017 and also NIH, National Institute of Health Training Institute for Dissemination and Implementation of Research in Health Travel Fellowship, and visited USA in 2015. She had 15 publications in reputed international journals. And currently her research activity includes integration of an AI platform for screening of diabetic retinopathy in public health facilities. It is a pilot scale study of Niti Aayog funded projects. Similarly, she is also involved in the study of multiply fortified salt among women on reproductive age in India. This is through Bill and Melinda Gates Foundation project. Similarly, also involved in the Haryana demonstration project on wheat flour fortification to improve iron, folate and vitamin B12. She is a member of Institute Research Committee of PGMR Chandigarh, and also an expert group member of Low Vision and Research Priorities in NPCB, World Health Organization Southeast Asian Region of Expert Group meeting in 2017 and currently also. And also the member of a project advisory group of Every Prime Scale project in 2017 and 18. With this brief introduction, and may I now request Dr. Mona Duggal, Madam, to come on to the dais and deliver her talk, please.
Can I have my presentation? Yeah, PPT. Namaskar. I think generally now I am being called to kind of work on the data. So I thought, given my new role, but it's not that it came to me like this. So I think when me and Dr. Reena started, I think the first thing which was my focus every time, like since my days when I started, had been data quality. So I'm going to tell you a story because I think everything then you actually can get from the books, but it is always better to like learn from the experience. When I was a senior resident at PGI and when we were collecting data, I always questioned the way we collected data. I always had this like data theek se nahi hua. So when I went to Hopkins, I think I was one of the few people, I think there were literally 3 people who took this data management course that was available, and it was in Microsoft Access. So that was my first exposure, how to collect data. But then I moved on. I moved to Yale, and luckily I think I just got lucky at that time. Informatics was just starting. It was as a branch. So I did my thesis on occupational health. It was a small data set. Did it in Access, so did it well. But then I think, really learned about big data from my experience. I got this opportunity to do this fellowship in medical informatics when people were not even thinking about it. So my mentor, Professor Amy Justice, she was an epidemiologist, but she early on learned that it was highly important to how you collect data, and the quality of the data was very important. So she started small, but then if you heard the veterans VA system in US, she started very small, but then she collaborated across 8 sites, and it was a collaborating center for 8 sites and 80 centers across US. So you had an active data collection at 8 sites and the secondary data collection from those things. So my exposure about how you collect data, how you can use data came from the 8 to 9 years that I worked with my mentor. And then she tasked me, she said, Mona, you start with healthcare outcomes. So I started the outcomes research group. So everybody, like based on the specialty, they were given that task. But then I had to move on. It was like I had 2 choices, either I stay in US or I come back. But then being a field person, being a public health person, I knew I cannot keep on working on secondary data. I had to be, like, I loved field. So luckily when I came back, my first job was with Professor Ganguly. I learned everything about policy and everything and how policy works. And I generally joke, I think we all started a career together. I think I met Dr. Paul at that time, and now he's at the highest level, but we all grew together at that point. And then I got that opportunity to be back in Chandigarh, and it was 2014, and that's where me and Dr. Reena's story started. I met Dr. Rajesh, and he said, you are going to be posted at Narayangarh, that is the Rural Health Training Center. And in the other terms was, like, nobody wanted to go to the rural posting. So it was like, jahan nahi jata, main tumhe wahan post karunga, you can see. For me, it was a wonderful opportunity because it gave me a platform to actually apply whatever I had learned. And the first project that I was given was, and the reason I was given was because I had come from US, and this project was coming from CDC and WHO. So they were collaborators from US. So Dr. Rajesh thought, ठीक है, चलो ये दोनों से बात कर लेगी. इसको इंडिया का भी पता है, उसको ये भी पता है. And I had zero idea what fortification was. The only thing I knew was implementation and data quality. And then I think I met Dr. Reena. This entire thing then at that time started at that point. So that's why I said why I'm very passionate about data is the first thing that we did was, even when we started, was how you collect data. So the person we were planning to hire, people didn't really understand. I said, no, I really need a very strong data person who is going to collect data. My first adjunct faculty position was again at IIIT Delhi, because when I came back, I really needed a place where I could actually bounce off, work with people who could actually understand how to collect data, the quality of data management. So I went out of the way, I took an adjunct position at IIIT Delhi. worked with that team before this boom came around AI and everything. So that was the time when we were starting to build those collaborations. So that was a story I wanted to set the base and why it was so important and why people at that point did not really understand. If you do not have good quality data, your policies cannot be made. Whatever policies are made as based out of the data that you collect, and if you do not have the quality data, it is not going to happen. We did one good quality project, and to this date, I think me and Dr. Reena are called because of that one quality project. And it was so well done because it was a perfect implementation science project. So everything that I had learned came together in that one small town of Narayangarh. So that is a story, and I think I will give you a brief because that is something that everybody will understand given this day and age. But how that small study impacted so many of the decisions that policymakers had is what I wanted to focus on. So as we know, there are 2 billion micronutrient deficiencies. People are affected globally by one or more micronutrient deficiencies. 1.9 billion are overweight or obese. And it is the #1 risk factor. Poor diet is responsible for more deaths globally than any other risk, including tobacco. Traditionally, dietary assessment methods are burdensome self-report measures, subject to recall and portion size adjustment errors, and provide provision of fragmented data, especially in LMICs. We are all aware of the national efforts of fortification and supplementations have addressed this burden adequately. Subnational data on micronutrient biomarkers and dietary supplies indicate an unequal distribution among different geographies. Global Nutrition Report proposes nutrition data revolution, calling for quality data in policy decision making and a nutrition data value chain from data collection to policy. So I'll be brief here because I think a lot of these things I've covered earlier. Nutrition data is available at scale, but however, it is often fragmented, non-comparable, and not integrated across systems, limiting its usefulness for real-time decision-making and policy design. So one of my favorite examples I generally give is the National Family Health Survey. And interestingly, if you have looked at the National Family Health Survey, there's not a single question on infertility till date. And have you ever questioned why? Although we all know it's rampant. Now the infertility clinics are rampant. The TFR has gone down. But Sikkim is already in the process of how to reverse that. But there's not a single question on that. Because how do you collect data has always been the traditional design of data collection. Most of the studies that are designed, and when we have to go for active data collection, are either rural or semi-urban. We do not want to go into the urban areas because we know the doors will be shut, nobody is there. We do not have a system to collect data from the urban system. So it is a heavily biased system on which your policies are made. So do you think that we need alternative ways how to collect data? So that is a food for thought as we are deliberating on this important topic. But something to think about, what are the other ways to collect data? Is the traditional method that has been used on which we are putting our policies, is that something that we need to rethink? Private sector has enormous data, but have we tapped into it? Have we made any policies so that they are able to share that data? Have they legalized the data pipeline so that they are willing to give you data? You have huge pharmaceutical data, diagnostic labs where all this data is being collected. Has ever government tapped into it? Have we encouraged them, okay, this is like, can you share your data? These things are now coming up with more and more AI models. So if you actually ever ask an AI model company, how did you get the data, they will never answer you. You will get a blank, or it will be a, because we do not have any data governance framework as of now in India. So this is, again, I'm just leaving you with those questions so that you start thinking. Because rest of the things you will all think, but things that will make you think around the things that we have already done would actually help you think about how you want to now base your surveys and make newer applications and how to get people on board. So these are been the traditional methods that we have looked at. The traditional ways of micronutrient assessment, large-scale surveys that are done by the government, consumption and dietary data, household dietary diversity, food access and affordability analysis, behavioral and demographic analysis, surveys for recording patterns in nutrition outcomes by age, gender, location, and socioeconomic status, real-time data platforms to track coverage, uptake, and effectiveness. Behavioral and demographic analytics. Who do you think has the maximum data on this? Any hands? Which are the companies you think would have that data? Urban areas. Zomato. All these people who are delivering your food and Google, all your real-time data is going there. But does government have access to it? No. We have access to this, which government actively is promoting data, like we are actively. But there's a huge secondary data market where all your data is actually going abroad, and there's no way to pull in that data so that you can make your policies. So the real world challenges in nutritional data research is underdiagnosis, ineffective programs using through data utilization, data integration. There's a delayed policy integration, poor program design, insufficient data disaggregation, and lack of interoperability. The way your AI and the machine learning and real-time things are happening, by the time we collect data by the traditional methods and by the time it comes into the mainstream, it is already too old for us to do that. So we already have a few digital innovations for dietary assessment and planning, and many of the self-help apps that are there on the mobile phones, the companies are already there. So you have Healthify and all, they're already tracking your data. And if you ask me, if I ask them, they will say, okay, they will not come to the government because the first thing is, how did you take consent? Is this time now to rethink what consent is? Because I think there are all these questions that we need to think. Is there a way we say, okay, if you are voluntarily sharing the data, maybe it's not a bad idea, some of it you can share with the governments because we are the people who are making the policy. Vision-based AI assessment, using computer vision to automatically detect food, estimate portions, and calculate nutrients. So vision-based AI assessment is also being used like when you go to a grocery store, you might want to say like in the markets, where does your first, how you put the shelves, there's a whole science, they do it. So when I was in Hong Kong for this policy meeting, it was a very interesting thing that I realized. My son, who really younger one, he loves cooking. So he told me, when you go, please bring me something about Hong Kong. So I was at the airport, I was trying to find specifically for Hong Kong, and I asked him, what is specific to Hong Kong? Because the chocolates and everything were Belgian. So the answer came back, we have no chocolate, no candy policy. So in Hong Kong, you do not have it, and I think if you look at China and the other East countries, the obesity levels are quite low. So that policy is in place where they do not actively promote. Even agar aap shake peene chahenge, bahar, if you take the shake there, they do not add sugar to their shakes. It is all natural. If you want, you have to ask for it, but the first thing is they will give you shakes without sugar. Unlike here, where even in your juices, they put sugar in it to make it tasty. So this is the nutrition data value chain in response to the data problem. Prioritize the key indicators, identify essential metrics for nutrition assessment, collect high quality data, gather detailed and reliable data, curate for interoperability, ensure data systems can communicate effectively, analyze gaps and trends, identify disparities and patterns in nutrition data, interpret and act, develop, implement equity-driven nutrition policies. Of course, we have now the Sampada program that is being implemented through ICMR, but these are the government initiatives that are supporting data-driven nutrition. And a lot of these things, I think, have come through CNNS and around anemia, how you collect data, what is the right method of collecting blood, what is a gold standard. So, of course, we have evolved, but I think there's a lot more to do. And nutrition, I always feel, is that one area with FSSAI having a very strong regulatory body. I think it is a right time for everybody to come together, because already we have 10 years of thing, and we have a lot of centers for excellence, a lot of work has gone in. So if everybody comes together, till now I have, like, because I've worked in a parallel in the diabetic retinopathy, I always feel probably this field has also matured to an equal level, but nobody has actually brought it in the mainstream. When we think about AI, it is always radiology, imaging, and everything. But nobody actually says, okay, nutrition is equally important. I think we are already there. It is a very low-hanging fruit. We just need to make it real-time and start using those methods to integrate the data and start implementing it. So this was a case study one that I'm taking. It is a data-driven integration for greater impact in the PDS system. So again, this is a story. When we were starting the wheat flour fortification, we got a huge pushback to implement this program. The secretary there, he said, I cannot distribute flour. I know how much corruption is there. This was a thing. He said there was a huge pushback around the PDS, because he said it is very difficult to implement. And secondly, it was around the time of the time of delivery, because it's just 30 to 60 days, the supply chain and all this. So we have come a long way now. So our first thing was, okay, just let us do the first part. Let us assess how much is the problem. Then you can decide whether you want to do fortification or not. So with big reluctance, we got our first into the state of Haryana. And that was my first way. I actually saw how the advocacy worked. Dr. Rakesh Gupta was there, who was leading from the front at that point, who was at the NHM and principal secretary. I saw how if you have somebody within the government who actually believes in the system, and this makes a difference, they can lead to a policy change. So immediately after the results were out, the PDS was started. So this is long back, like this is now the what is being done. But I'm telling you, around 2013 and 14 when we started, and eventually it was started, it took us at least 2 years of advocacy before we could get this yes to start the program, at least for just the simple assessment of micronutrient deficiencies. So this is a data-driven learning, has enabled the continuous refinement of National Food Security Act policies and delivery mechanisms based on real-time data, local feedback, and interstate lessons. It moves NFSA from static entitlement system to a responsible evidence-based delivery model that evolves with implementation insights. Data-driven approach on rice fortification initiative by Department of Food and Public Distribution, Government of India. And this is just a snapshot of what we are looking at. And that's why I said, at least in fortification, we are starting to talk across the ministries. It is a policy, it is a technology, and you have the public distribution system. So you have cross-line talk. When you talk across the ministries, things start to move and the wheels start to move. So FSSAI has launched the Fortrace portal that allows end-to-end traceability of procurement and manufacturing of fortified rice to allow evidence-based verifiable supply chain management. So of course, whenever you start, there is always going to be an iterative process. Problem is we have to be patient. In US, when the program started, it was in 1976, and I joined in 2006. So it took them 30 years before the thing started to mature, and finally another 10 years to evolve into a big program. So give yourself time. I think we already have a lot of learnings from other states, so the learning curve is going to be small, but give yourself time, think big, wheels will start moving, and eventually you will reach when you have enough good quality data to start the evidence policy-based decisions. So this is just one of the examples at the Odisha public distribution system and other welfare schemes. So this is what I wanted to come to. So these are the two, I think, some of the biggest, like one of the best two studies that we have done in the northern India. One was a Haryana demonstration project on wheat flour fortification, and the other was effect of quintuply fortified salt on micronutrient status of non-pregnant women of reproductive age in Punjab and India. The approach that we took to collect data was a mixed method approach with a web-based tracking system to tackle data collection challenges in population-based studies. Policy with empirical evidence translates data and insights into nutrition policies. I wanted to give you a small anecdote. People who got trained in this were eventually reached the top echelons. So Haryana fortification project was signed off by Mrs. Enoshi. So not many people know that, but I remember me and Dr. Reena, like, because when we started, she was like, why do you even need to do the study? And then as we went along as the advocacy, and we all know, in the end, she was leading the FSSAI fortification from the front. So when you do good studies, on the side, you get a lot of the policy makers also get trained. It is not only us, it is if you are taking the state along, you can see how it has impacted at the national level. So these things do impact if you do a study well, even if it is small, and if you take everybody along, there's a lot of capacity building. It was done in 52 villages across 2 blocks of Ambala, which were the rural blocks. Again, that is where the bias comes in. We again focused on rural blocks because of the ease of collection of data. Whenever you are doing the sample size collection, you say what is the rate of your, like how much is people are going to fall out of this thing. It was 20%, and we knew this is only going to happen if it is at the village level. In urban, we are not going to get that thing. The other one, the salt study was done in Mohali district. This had a story. We had to move from Haryana to Punjab last minute because Haryana had decided that we want to roll out fortification in all the districts at that time. Ultimately, it did not happen, unfortunately. But at the time we started talking about this, we had to move from Haryana because they refused. They said, we cannot give you even 5 or 10 villages to do the study. So, so we had to move at the last moment. In hindsight, it was great because the moment we moved, I think COVID started. So, so being in Mohali, I think it solved a lot of those issues. We were able to conduct the study despite all the COVID challenges. So when you are doing it, we do not think in the hindsight, but when you are doing now, we say, okay, whatever happened, it happened for good. So this is a workflow. Like any time you are starting a study, please make sure that you have a workflow, how you collect the data. So this was something we had worked with. So again, how capacity builds. The person we had hired to do our data management, he's now the principal scientist and at Indian School of Business. He came from a very small place, and when I had interviewed him, there were 2 people I was supposed to interview. One was who was already working in PGI, the other person was this. And the reason I picked him up was because he actually talked sense. It was a person I was looking for. I was under a lot of pressure to take the person who was already trained in PGI. I said, no. I said, there's no way I can take. I really need a person who can do entire data management. And today I feel very proud when I see that evolvement, that he has been picked up by Indian School of Business, and they're now trying to get him on like a permanent faculty on board. So it is like the training that you give and how you expose to the people and the management and where this leads to. So for everything, how you manage the data, you have to have a flow chain. So this was done with, this was the Sidekick, this was a company we identified. It was a small company, then we got them on board, we worked together, and we made the entire thing. Biggest learning from this was we had the barcoding in the labs. That had never been done before from the lab, so I'll give you a quick thing. So it was a mixed method that we decided. There was a rapid growth. We had 2 types. Either we do it on the tablet, other was we do paper, enter the tablet, enter it, and then go from there. For the household survey, we decided we will work on the questionnaire because the questionnaire was very big. And at that point, I can say it now, probably 10 years now, a decade, people who are coming are much more technology savvy. But at that point, what we realized was it is easier for the field staff to enter on the paper. So we had a double data entry system that was done. And there was an internet connectivity in the villages, questionnaire length and complexity, estimated interview times, need for data review before entry, and pre-collection NPWRA details for accuracy. But the demerits, as I said, although we had done all this, but then we decided to go with the paper for the household survey. And it was mainly because of the technology limitations and complex questionnaires and higher cost at that time. But for the SALT, that is India to the world, when the UCSF came to us, they were like, no, we will do it in Excel. We said, no, we already have a data system set up. So we taught them how to do the data, like we gave them entire data system and we set it up for them. But at that time we used REDCap because REDCap had already evolved into a much broader system, and we thought the household questionnaires could be integrated much better. And for the first time we used the tablets at that time. By the time it was 10 years down the lane, technology was better, the internet connectivity was better, and it was a peri-urban area. So that is where the difference was among the two surveys. So just a quick, I'm just going to skip this. This is how we had made the workflows. Please make the workflows when you are starting to do any data entry. So this is a must. And we had, like, at every level, we had checks where you are collecting data just to make sure that the data being collected from the woman is also the same. We had barcodes at every level. Once you collect the data, we had cluster forms that was scanned. Then we had the barcodes on the vials. They were supposed to be matching. Everything was supposed to be matching at that point. So this is a lab data collection. Entry was created from the cluster forms, blood sample collection and scanning of label in field, handover of blood samples at NPL, blood centrifuge, and the first phase of analysis. The time from collection of data to centrifuge to PGI, it was all the critical measures for you to have the data quality. And to say that, because now I think we just got a project and Dr. Reena is leading the TERIP project that is around the reference standard. Most of the community, how you collect blood from the community, this is something that we have already, like, you can say we have identified where were the loopholes, and it is a very specific way how you collect data and maintain the quality chain. We had the timestamps, how much time it took for every sample to get to the lab. So data compilation, of course, we had the unique IDs. We merged the data and data cleaning, analysis, and report writing. So these were the quality assurance checkpoints: field survey and sample collection supervision, assigning of barcodes, handing over the cluster forms from household team to the lab team, scanning of barcode in the field, double data entry and supervision, linkage of household data and lab data through barcodes and other details of individuals. Outcomes: we have high quality databases, publications in high impact journals, evidence creation and policy implications. The side thing was, I think, because of this training, during the COVID time, Dr. Reena did the barcoding for the entire PGI. So you can imagine how much patient errors got reduced, and we had massive inflow at that time, and how many vials we were supposed to take. So just this is another side product. If you are trained well, and you have other people who are trained well in these kind of systems, how it impacts the other systems. This was another thing. And in COVID, now PGI has a bar tracking system, which probably, like earlier, anybody who has worked in a medical college, you have to write. So now it is a simple barcoding system that was implemented at that time. So these are just a few from the SALT and our wheat flour project. Evidence creation. So we all know of the safety of iron-fortified rice for populations with hemoglobinopathies. It became a huge controversy. It was a joke. Dr. Reena meko kehti thi, Mona, why do you have me in this project? I really don't know why you have me. So when this came up, I said, here is your moment of glory. So we actually, this is something that, you know, like this was led by our team. You all know that there was a warning label at that point. So at that point, I think this is where having a person from HIMAT and who had the experience of working in the field in fortification helped turn the tables and creating that evidence. Because she had a fair understanding around fortification and hemoglobinopathies, and when you have to give that evidence, only a person who has both these areas of interest or who has worked in that area would be able to give you a convincing answer. So quickly, we know that this warning signal came, and this was the government fortified rice will carry health warning, and this is where the outcome was. Not many people know we had a lot of those advocacy meetings. Ultimately, I think FSSAI and the ministry had asked the DG ICMR to constitute a committee. And when this committee was constituted, Dr. Reena was there. And the evidence, it was not the world evidence. It was the evidence from our rice, from our wheat flour fortification, which actually clinched the deal. So we had 30 participants who had thalassemia, who were thalassemia carriers in our field setting. That data was given as evidence to ICMR at that point, and that was one of the key evidences from India that helped us. And now we have an ongoing study from ICMR looking at impact of fortified wheat flour on micronutrient status among carriers of beta thalassemia, which got funded immediately after that. So at that point, we had put in a study around this because we thought this was a burning public health problem, and it is funded and it is ongoing. In this also, there was a collaboration between Denmark and PGI Himat Lab. So Android app like Susoka was developed where there were 5 red cell indices had been taken for this to develop a clinical decision support. So that has been developed and tested in the clinical trials. So in this, we are actually testing them in a population-based setting just to see if it is equally effective and if we can, do not need to use the expensive HPLC method. So we will be measuring everybody who tests positive, that person will be having the HPLC, and in addition, total will be 1,800 will be screened. So we are estimating that we will identify around 100 beta thalassemia carriers. In addition, we will be testing 1,600 just to make sure that the Susoka app, how it is working in the field setting, and if there are any more iterations that needs to be done. Now, second burning topic has been evidence around impact and standards. So this was our first, the phase 1 findings that we had come out with, based on which Haryana started fortification in those 2 entire Ambala block. As you all know it, immediately I think we presented the results to the committee in December 2017. March 2018, the program was launched. And in April 2018, MDM and ICDS was also brought in. And in June 2018, we open market, fortification became available in the open market. July 2019, amount of folic acid and vitamin B12 in the premix was lowered by 90%, but luckily for us, the project sites were exempted. And what were our findings? And when we went in for a post-fortification impact, again it was like, it was very heartening to see that although these findings were very good, it was also, you have to understand, this was during the COVID time. So most of the people were actually eating the fortified flour, whoever was a purchaser of the PDS at that time, because there was no other option. And these findings, when I was in Hong Kong, actually a similar thing was presented from China, and they had similar results. So it was very heartening to see, because we were thinking, was it something? For them also, during the COVID time, the food security was actually better. So the indices were actually came out to be better, because probably people were eating more healthy. Because of the entire fear psychosis, people were eating more healthy, and they had direct access to the PDS. And PDS was fortified. And those 2 sites actually got the PDS. So why I'm showing this is because our findings were actually validated by the NFHS also. So the findings were similar. So it was an independent survey by NFHS, and they got a similar thing. And Ambala, you can see the percentage reduction of anemia among women of reproductive age was 33% during that time. Being the project site, there was a lot of emphasis on the quality of the PDS, and it was continuously monitored by FFI. So we can see Ambala had the highest decline during that, from NFHS 4 to NFHS 5 during that time. Second most important finding was from our survey was the RBC folate concentration increased post-fortification. The difference in the so it was overall, so we had actually divided into the purchasers and non-purchasers. Although overall there was an impact both among purchasers and non-purchasers, but the difference in the pre-fortification was the optimal RBC folate concentrations for prevention of neural tube defects was more. The level was more in the people who actually were the purchasers and who were eating. So who were not like diluted. So other people were eating other things, but people who were solely on the purchasers and who we had confirmed were actually getting from the PDS and were eating that wheat flour, reached the optimal RBC folate concentrations for prevention of neural tube defects from the CDC laboratory. So this was a paper that came out. And conclusion was NTD prevalence in our population is similar to unfortified regions and higher than in countries with mandatory folic acid fortification. The analysis was done on the pre-fortification data. So we have been unable to do the post-fortification modeling, but this is what was our, when we had done the fortification, without fortification. So this was the Center for Advanced Research that we had proposed before I left for Delhi. Unfortunately, it did not get funded, but just to give you the thing, why we thought it was important, it was built around our 10 years of our experience. It was to build a comprehensive competence center for micronutrients research and surveillance, establish and validate capacities for micronutrient evaluation scalable across geographies, develop a data-driven analytics and decision support using AI which can draw from multiple data sources, harmonize and synchronize with research and regulatory frameworks to provide policy directions and act as guideline for further research and extensions by other organizations. The unique thing about this was we were actually partnering with most, including FSSAI. So we had their letter of support that they really wanted to partner on it. But unfortunately, I think it did not get funded, but I feel down the line, this idea is eventually going to get incorporated with such a big push around the data. So this is around capacity building, evaluation, and advanced analytics and policy directions. This is a key slide that we thought would be important. First was the activities. PGIMR and NIFTEM, they were going to develop the tag training of trainers around nutrition, hematology, and epidemiology. Doing market surveys, micronutrient assessments, dietary and blood. Data synthesization, integration, advanced computational techniques, and dietary modeling at the AI analytics level. This we are planning to, since I already had that position in Delhi, planning to partner with IIT Ropar at that point because they had received a COE for agriculture, getting the agricultural perspective or the One Health perspective around that. And of course, FSSAI in the advisory role. We all who sit on the advisory panels, I think many times the things are not taken up because they say there's lack of data. So unless until we actively promote data collection around the questions and we generate evidence, we will not be able to make the change. So this is strengthening India's nutrition data ecosystem, systemic solutions for timely actionable insights. This is something that is just a table that I'm not going to get into. You can just have a quick look at this. Last four, I think this is what we are planning. I think we already are, we have the partners on board. It is a collaboration between PGI, National Institute of Nutrition, St. John's, GAIN, and NIDHR. We are all collaborating together with a plan that we will have a project advisory group where almost what we had proposed earlier, which was a much broader. This is around vitamin A and D fortification, and we hope if this gets successful, this can be taken up as a broader thing for other micronutrients. Because Establish and carry out sentinel site monitoring to identify good practices and gaps in program implementation and support making. Necessary program adjustments to achieve desirable impact using serum retinol, RBP, CRP inflammation marker, and serum vitamin D. There's a lot of talk that vitamin A causes toxicity. So this is now something that we wanted to see. Is there a toxicity, or there's undernutrition, or there needs to be targeted intervention? Although now Ministry of Health has actually done away with it, IAP no longer recommends, if you look at the guidelines, at least in PGI we are not giving vitamin A, but what is the real picture? We do not really have that identification. Again, this has a story why I went after vitamin A. It's a joke because I was in ophthalmology, so I was always being questioned, why are you working in fortification? So I was so frustrated, I said, you know what, let me just find a micronutrient that actually has an impact on the eye. So the story started, and then again, I think I met Professor George Litz. And then there's an entire story that we went to his lab, and then we talked to Ruchika, and this entire thing happened. And I'm happy I went because I was not planning to go to Professor George's lab at that point. But the person who was supposed to go, we were going down to get the ticket. She said, my visa got rejected. I told Dr. Reena, and me and Dr. Reena were like, what will we do? We are not the right people. So, because the person who was supposed to go was a biophysics person. So she was supposed to give, but then it was good that we both went. I think that story started from that one visit to the lab and one presentation. And we are happy now that is starting to take place. We are just in the midst of getting our ethical clearances and everything on board. And of course, the capacity building for carrying out isotopic vitamin A pool size studies to precisely study the impact of multiple interventions will again give us this capacity building part that we are looking forward to with the Newcastle University. Outcomes that we are looking at is establishing sentinel site monitoring framework for the fortification program, oil and milk, and I do hope it expands to the other micronutrients. Capacity building for carrying out isotopic vitamin A pool size studies to precisely study impact of multiple interventions, especially in preschool children, and strengthening of standards as per the data made available through the sentinel site monitoring. Quickly, these are the sites that we are looking at. And study assessments, and these we are actually looking at a few medtech things. One will be actually looking at the Cyclops or the Mayors, where there's a 3D Mayor, and looking at the pupillary size. Does it have an impact, like what is the dilation and what is the impact? We will be testing that out because probably the isotopic studies are very expensive. There is something like a screening tool that we can just base it out on the night blindness. Those things we are going to be testing, and if there are other things that come along the way, we would be happy to take it up during this thing. So GAIN is going to be helping us the market level assessments in milk, in oil, sorry, and rest all will be done with PGI in collaboration with NIFTIM and other private partners who have the capacity to do it. So this is what the outcomes we are looking at, similar to what we had told earlier. And as I told it, more food to thought. Like we can use, I think, latest CSIR, there can be satellite data modeling and application in nutrition. Second, we can see if Zomato is willing to share their data, if there is a way to get their data. Pharmaceutical industry, which are dispensing a lot of vitamins, if they can be pooled into the group, if they can share the data, we can look at the diagnostic labs that have the data. Other ways to get secondary data and integrate into the active data collection so that we have a much more robust data-driven policy and evidence to make the policies. Personalized nutrition, disease management, and policy implications. This is a future success that requires addressing data quality, bias, privacy concerns, and digital divide to ensure equitable access to nutrition technology. Summary, policy design and course correction are rarely grounded in timely granular nutrition data. National tracker that will offer valuable insights in biomarkers, data integration, and real-time use. Prioritize key indicators, collect biomarker-linked data, and enabling analysis and essential action. Meaningful policy change requires institutionalizing a responsive, integrated nutrition data from program design, implementation, and monitoring. Nutrition policy must evolve from evidence awareness to evidence-embedded action. Thank you.
Thank you, madam, for highlighting the significance of data pooling and data management and its use in tools like AI tools to address the global cause of hidden hunger. Heartfelt gratitude for sharing your experiences through case studies, ma'am. May I now request Dr. Sridevi, madam, to present a memento as a token of appreciation to Dr. Mona Duggal, madam. I also request Dr. Giridhar, sir, to accompany the guest. Thank you, Madam and Sir. May I now request the August gathering to join us for the demonstration of IHRF innovations by CSIR-CFTRI and IIT Delhi, arranged at Quadrangle. I also request you all to join for the tea after the demo and kindly join us back by 11:15.
Hello. Hello, check, hello, hello. See, change ಆಯಿತು. Hello, check, hello, 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 check, hello. Hello, check, hello, hello. See, hello. See? Hello, check, hello. Mic testing 1 2 3 3 2 1. Hello. Hello, check, hello, hello, hello.
Hello, am I audible? Hello. Tejas or Manohar, can you hear me?
Hello. Sir, Tejas here. Am I audible?
Yes, there's someone is talking. I can hear you. Can you hear me?
Yeah, yeah, we are able to hear you.
Okay, fine.
Sir, am I audible to you?
Yes, yes.
Ah, okay. Hello.
Is my PowerPoint
Hello. Voice
is
is
my
audible,
screen
sir?
visible? Is my screen visible?
Yes, it's
Hello,
visible.
sir. Sir, you speak, sir.
Yes.
Our voice is audible?
Yes, your voice is audible. My voice is audible?
Yes, sir. Yeah, voice is audible, sir.
Okay, my screen is visible?
Yes, yes, the screen is
Yes,
visible.
sir. You go next slide, sir.
Please change the next slide.
You go next slide, sir. Slide show. Yeah, visible, sir.
So the slide, the full slide is coming or the half slide is coming?
Your slide, sir. It's visible, sir. Okay.
So is the slide changing or not?
Now you change, sir. The first slide will be there.
No, the slide is not changing, I think.
Oh. First slide. Not moving.
Now you see,
Yeah,
the other side
it's
is moving.
coming, sir. It's coming. Go. Yes, sir. Yes, sir. It's coming, sir. Okay, sir. Yeah. Okay, sir. Thank you. Yeah.
Hello. Sir, am I audible? Uh, can you please turn off the mic? Hello. Syed Mohammed, sir.
Yes.
We are checking the output for YouTube. So for some 30 seconds, can you please speak? something. Hello.
Yeah, is it okay?
Yes. We are checking for the YouTube casting.
Your voice is coming a little slow. Can you be a little more audible?
Am,
Loud?
am I audible now?
Yes, now you're audible.
Yes.
Am I clearly audible? Do I need to do something else for that you can complete the checking process?
Hello.
Yes.
Sir, we are checking whether your voice is audible in the YouTube. So can you please speak for some 30 seconds so that we'll check the audio quality.
So first of all, thank you for inviting me for this national workshop on hunger, and I'm happy to present this CHR initiative in UP. And I think it's a wonderful journey that I would like to share with all of you. And so this all started with a long initiative that we had in UP and the engagement in the background that was there in terms of challenging of the distribution of take-home ration initiative. So first of all, I would like to bring to your light that what do we exactly mean by the take-home ration initiative, what the scheme is all about. Is that okay?
We are checking, sir. Just a minute. Because there is a slight delay with the YouTube. So it will be like 1 or 2 minutes delay. We'll check it.
Welcome back to the technical session 5. May I now request Mr. Manish Jha to take forward. Hello. Welcome back to the technical session 5. May I now request Mr. Manish Jha to take forward the sessions.
Hi, good morning everyone. I hope your minds are fresh and your curiosity is even fresher, because in the next 30 minutes, we are about to explore something that touches the lives of millions with simplicity, science, and scale. I'm Manish Kumar Jha, and I have the honor of moderating this session on innovations and opportunities in take-home rations, UP and nation experience. As a food technologist, I often get asked what exactly we do. The easiest way to explain it, yeah, we don't just process food, we process impact. And the take-home ration model in Uttar Pradesh is a shining example of that, where food science meets social transformation. Today's session is not just about THR, it's about women-led enterprises, improved nutrition, and science-based innovations. Being translated into real system change, our two distinguished speakers will take us through how all of this has been achieved at scale and with purpose. So I'm welcoming my first speaker, Dr. Siddharth Vagulkar. So our first speaker is Dr. Siddharth Vagulkar, Deputy Head of Nutrition and School Feeding at the UN World Food Program in India. Dr. Siddharth brings over 12 years of experience in public health nutrition. 12 years of experience in public health nutrition. He has worked across the national and state level with government as well as private sector partners, and has significantly contributed to nutrition policies, especially related to prevention of severe malnutrition in children as well as large-scale food fortification. He is passionate about addressing the challenge of malnutrition among the most vulnerable. His areas of interest are anemia, food fortification, treatment of children with severe acute malnutrition. Dr. Siddharth holds a master's degree in public health, specializing in health policies, economics, and finance from the Tata Institute of Social Sciences, and has been trained on management in nutrition in emergencies from the Asian Disaster Preparedness Center, ADPC, Bangkok, and University College of London. So I welcome Dr. Siddharth. Yeah, so my guest speaker for today, he's Mr. Syed Muhammad Adil Abbas. He's joining us online. He was about to join this physically, but due to some circumstances, he is joining us online. So Syed Muhammad Adil Abbas is a seasoned development professional with over 20 years of transformative experience in rural development, poverty alleviation, and public health program implementation. He holds a Master of Social Work degree from AMU, currently serving as an Associate Director, Health, Nutrition, and Women Economic Empowerment with PCI. He has vast experience of working with government and especially has worked with Uttar Pradesh State Rural Livelihood Mission, UPSRLM, for more than a decade in different capacities. Adil is acknowledged for his contribution in fostering inter-department collaborations, partnership between UPSRLM and Department of Women's and Child Development, Directorate of Fisheries, Department of Horticulture, as well as experience of working with multilateral organizations like World Bank, UNICEF. His efforts has been instrumental in integrating health and nutrition with community platform promoted by UPSRLM and further scaling up interventions to all 75 districts and 826 blocks of Uttar Pradesh. He has immensely contributed to grounding and scale up of take-home ration initiative as to 204 micro enterprises in Uttar Pradesh. Mr. Adil is leading several initiatives, projects around women economic empowerment like fisheries, beekeeping, and powering women enterprises through decentralized renewable energy. So I'm welcoming my other speaker, Mr. Adil Abbas, for this. So now I think, now Dr. Siddharth, the floor is for you. You can please take your seat.
Load the presentation. Good morning, everyone, and I want to thank firstly the director at the CFTRI for inviting us, and IHRF and all the partners who are involved in here. As the World Food Program, it's really an honor to come and talk to you and talk about this very special project that is the Take Home Ration Initiative. especially because when Director Madam yesterday talked about, the take-home ration work that she has done, how the nutritional improvement has been brought about. So I think very similar lines, I think I also want to showcase the work that WFP has done on this particular aspect, and what better way to start. And just to give you a brief introduction, WFP is the food aid arm of the United Nations, and we've been active in India since 1963. And primarily in India, our work is to provide technical assistance to the food safety net program that Government of India runs, and we look at nutritional improvement of these food safety net schemes. Before I start my presentation, it's just a very brief slide. I will not take into a lot of things. I just wanted to show you a small video so that the audience which is there, I mean, the video will give you a very good visual representation of the work that we're doing. So I'll request the colleagues here to start the video. Yeah, play. Thank you. I think the video itself is quite self-explanatory, but just to give you some context about Uttar Pradesh and what the state looks like. So it's a state which has nutritional vulnerabilities, and you could see that 35% or more children are stunted, and around 19% of the children there are wasted. Why at WFP we focus on, say, the THR, which is being distributed through ICDS? Now, if you look at this particular aspect, the THR is something which reaches out to the critical first 1,000 days of life. It reaches out to vulnerable children. It reaches out to the pregnant and lactating women. And plus, if you look at the overall NFHS data as well, the overall utilization and uptake of THR is very high as well. So why not utilize this THR to improve nutrition in the state? So with this same principle, we went ahead and sort of, also just to give you some background around this, in 2019, with the Niti Aayog, WFP did a nationwide study to understand what is the take-home ration being distributed across the country. And basically what we did was that we picked up samples and we looked at the product compositions of THR across the country. What we found out that, most of the products that were given as THR were basically made from wheat and soya-based products. So, I mean, if you talk about the protein content was primarily coming from wheat and soya. Now, if I look at the sugar levels were very high. I mean, just to make up for the calories in the product, there were high sugars which were added to the product. So that is where, again, the THR as such, nutritionally, it was not a great product. Next slide. And there were multiple gaps as well. I mean, there was no linkage between the ICDS and the take-home ration. I mean, the messages were not there. The Anganwadi workers are not aware as to what needs to be talked to the beneficiaries and everything. So again, that is, I mean, just about the product. And if you look at an ideal product for a young child as to what is the nutritional composition which is needed, this is something which was already discussed. The PD-CAS score being there, the milk sources, or say the milk proteins should be there, the energy and fortification, all of that we've talked about yesterday. So that is where this particular project comes in. This is basically a gender transformational project which places women at the center of all activities. And you could see that women are involved in the production of take-home rations. The key objectives of this project are primarily to improve nutrition among the vulnerable beneficiaries of the Anganwadi. But apart from that, we have other collateral advantages as well, that women who are working on production of take-home ration, they are generating income and revenue from that. And plus there is awareness around take-home ration among the users, and plus timely and uninterrupted distribution of THR. As WFP, what we did was that the existing recipes that were there being distributed in Uttar Pradesh, we also sort of looked at the formulation of these recipes. And this is what we found out. The recipes which were there in Uttar Pradesh, it had a high sugar content in the product. There were poor micronutrient content in it, and plus the quality of proteins was very poor. It was primarily coming from wheat and soya. And then there was low fat content. There was no quality assurance, quality control in this, and plus there was no link with the community as such. So as WFP, what we did was that we revised the entire take-home ration recipe formulation. We did a complete revision of the formulation as such, and brought up the protein quality in it. We used a mixture of, say, pulses in there. There was Bengal gram, there was moong dal, which was added. There was also animal source proteins in the form of skim milk powder, which was added. Then increase the fat content through ground nuts and through edible oil, which was also brought up. The sugar content was brought down, and then we fortified with vitamins and minerals. In terms of launching the product, we did a production trial, we did a shelf life analysis, we also did some acceptability studies of the product as well in the community. And then we looked at improving the QA/QC protocols and testing it through an NABL laboratory. And you could see the initial products that were there. We changed the packaging designs and everything to accordingly, so that it's color coded and you sort of avoid the monotony in the ICDS scheme as well. There were multiple variations of these recipes as well. You have a sweet variant, you have a savory variant, so that the monotony also does not stay there. So this is something which is primarily about the take-home ration project. And just to give you some context, to operationalize this particular model, WFP set up these two plants. And based on the learnings of WFP's pilot plant, the centers of excellence that WFP set up, the government of UP scaled it up further to another 204 sites across the 43 districts, covering around 70 lakh people there. So during the course of this project, we also sort of built the capacity of the Anganwadi workers, gave them the necessary tools, gave them the key messages that needs to be delivered, how these recipes need to be produced in the community. So that was also done. There's also a dedicated 10-member staff, a program management unit, which is completely funded by the government of UP and placed in their own premises to monitor the project. It includes monitoring associate, includes financial associates who look over the project from a day-to-day basis. So now with the key learnings from this particular project, the simple fact that we look at particular national advocacy or say national policy making is that the cost of the recipes. Yesterday we talked about, briefly I also talked with Director Ma'am as well, that if you were to give highly nutritious recipes, it has to also fit within the ICDS cost norms. And currently the ICDS cost norms that are there, these are fairly inadequate. So that is where our focus was to sort of support that. And we, along with partners, we sort of developed a funding proposal also for the state government. So the state government has additionally given in around 250 crores to fund the recipes and sort of make it more sustainable and ensure that the nutritious recipes are being given. Going forward, along with the introduction of the NFSA, the National Food Security Act 2023, we have now revised our recipe to be aligned to the NFSA 2023 norms. And there are a set of around 21 recipes that we've developed. Production analysis, production trial, shelf life analysis, and the acceptability studies are again being done as we speak. And these are set to be launched by around, say, October 2025. With this, UP will become one of the first states in the country to also launch the NFSA 2023 standard aligned recipes. For WFP, we are implementing similar projects in other geographies like Rajasthan, Haryana, Odisha, Meghalaya as well, and thereby building up the momentum around improving the overall quality of THR by building evidence using across different states. In this context, we recently facilitated a visit of the Chief Secretary of Uttar Pradesh to our WFP headquarters in Rome, wherein this project was presented by him and owned by him, and he sort of demonstrated this particular project. And this video was sort of from the Chief Secretary's office itself. He's also decided to set up like a center of excellence in Uttar Pradesh with support from WFP. This center of excellence will act as a center for food and nutrition and research and development, especially for sharing knowledge and experience and learnings from its projects and others. So, and just wanted to share this particular, there are some IC materials and that we've developed. In the Anganwadi, there is cooking demonstrations which happen and they are being shown as to how these recipes can be cooked. There are products which are being developed along with them. There are videos available on YouTube which can be used by the Anganwadi workers as well. And there are multiple other initiatives, but definitely who would like to understand no more, I can take them through it. But this is just a few images that I wanted to share. This is the image of the Chief Minister of Uttar Pradesh, Mr. Yogi Adityanath, handing over the check to the WFP-supported THR unit member, their first check or their first payment for the take-home ration that was distributed in the Fatehpur district. This is the Prime Minister interacting with the women members of the take-home ration units that was set up by WFP. This is the Chief Secretary of Uttar Pradesh with our Executive Director. This is just as of last week, and wherein he announced that the Center of Excellence for Food and Nutrition will be set up in Uttar Pradesh. This is the news from that. So what are the key learnings that we get from the project? Keep the focus on nutrition across THR. There will be many stakeholders during the supply chain who will talk about, we should dilute the recipe, we should make it less nutritious. But if you keep the focus on nutrition, there is bound to be improvement in the malnutrition status of the state as well, and keep it aligned with the standards that are required. Integrate research around the development of THR products. When we talk about developing THR products, there should be production trial, there should be shelf life analysis, there should be acceptability studies as well. And even in the designing of the product, packaging also, that should be studies, or there should be research done around that as well. Build capacities of the frontline workers so that they are efficiently able to communicate about THR. Then leverage women's micro-enterprises so that it also helps to provide them livelihoods, increase ownership, and improved community utilization of the products. And then for us, what worked was the pilot to scale up model, wherein we were able to leverage learnings from our pilot to the statewide implementation of the scheme, and then ensure convergence between different departments. Like in case of Uttar Pradesh, you would see that the health ICDS is involved with the UPSRM livelihoods mission. So again, that's a very effective example of convergence across departments. And then adopt a hybrid model for procurement, especially when you work with women's self-help groups, you would see that the cost of the raw material goes up high. So adopt a hybrid model where you can see that high value commodities or high price commodities can be centrally procured and the other commodities can be then locally produced. So what are implications for national policy as such? Firstly, and the most important thing, ICDS cost norms or the recipe norms haven't been revised since 2017. And there is a need to urgently revise these recipe norms, because if we were to talk about a nutritious product being distributed as take-home ration through ICDS, there is a need to be these cost norms to be revised. So the current norms are fairly inadequate in order to provide a nutritious product. The other thing is that Government of India has come up with the National Food Security Act. Many states are yet to adopt the National Food Security Act. So again, those states which are present here and who would like to, so we would definitely be able to share experience from our work as well, but there is a need to move to the National Food Security Act 2023 standards. And the last one is basically, currently, even if you look at the ICDS norms or even if you look at the NFSA 2023 norms, there is no guidance around the use of milk proteins as such, be it in the form of dry powders or in the form of skim milk powder. There is again, as we explained yesterday, as Director Ma'am also talked about, there is huge potential to address stunting and wasting, especially among young children, if you add animal source proteins into the take-home ration products. So with that, I would like to end my session here, and if there are any questions, then I'd be happy to take that, as per what moderator sir says. Thank you.
I think we can take in last year. Are you there? Please, sir, go ahead.
Yeah, thank you, Manish. First of all, I would like to thank Director CFTRI for inviting us for this national workshop and giving us this opportunity to present this UP initiative on take-home ration. And at the same time, I'm also grateful to IIT Delhi for coordinating and giving us this opportunity. It was wonderful to once again hear Dr. Siddharth talk about the initiative, and it's made my life much easier because he's already given some overview to the audience over here. So moving ahead, I would just like to bring a little more perspective in terms of the details. So I think more about the scheme has been talked about, and he has already mentioned about that the take-home ration initiatives, which started way back in 1975, it has a lot of with the objective of actually ensuring nutrition supplement food to the children and women, also trying to bridge the gap between the supplementary nutrition and what's the intake it's there, and to reduce the levels of malnutrition and ensure that these are timely and qualitative in a transparent manner, which has been distributed. So this whole initiative, which started way back in 2020, and the journey started with the State Mission Director UPSRM inviting me to by giving an RFP of the ICDS department to have a look, and then it was like a backward working on the entire model. And on the next day, I was supposed to give this presentation. So we worked the entire night, and then we came up with the plan in which the ICDS gave us this, the director ICDS, Radha Chauhan Madam, gave us the consent to go ahead. So in that, we also looked into the different kind of models which were existing, some of them which were being taken forward through different states, where in Madhya Pradesh and Chhattisgarh, we identified that the model is more regional, where 100 metric ton capacity has been installed in, and a regional level plants have been set up, whereas in Odisha and other places, there are localized distribution of THR is taking place. In Gujarat, there is a collaboration where a state level collaboration is there in Rajasthan and Maharashtra, and more wherein, like in Gujarat, the Amul is providing the entire take home ration to the Anganwadi centers, and the centralized it's happening. And then basically in states like Telangana, where there is mixed kind of a model is being implemented. So and in Gujarat, all these the Amul is providing model the entire take home ration to the Anganwadi centers, and the centralized it's happening. And then basically in states like Telangana, where there is mixed kind of a model is being implemented. So and in all these models, there are a lot of issues in terms of quality control issues are there, operational gaps are there, limited women participation is there, and at the same time, lack of monitoring and accountability is there. When we started this journey, we had this challenge in the state that there has been an honorable High Court, Supreme Court has taken a cognizance of the appeal which was filed with them, and based on that, the earlier mechanism was there in which the private vendors were hired, and they were actually supplying the take-home ration to the Anganwadi centers. But there were a lot of issues and challenges, and the complaints were there in terms of leakages, in terms of quality issues, and where the THR was actually not being consumed by the intended beneficiaries, but it was being sold in the market, or it was going into. So considering that, I mean, the state government, based on the deliberations I mentioned in the previous slide, we came up with a proposal and intensively worked on the MOU part between the Department of Women and Child Development and Uttar Pradesh State Rural Livelihood Mission, and entire devising the strategy how the community will be organized into certain institutions, and then how these institutions will become the vehicle for setting up the THR manufacturing units, and then the program will go forward. Similarly, because the state at that point of time this was the first kind of an initiative that which UPSRLA was going to take forward. So it was important to bring in the technical partners like UNWFP and PCI India, which have a technical expertise on nutrition, and they have worked on in different capacities in different states with community level initiatives. So we ensured an MOU, which was up not only with the ICDS department was signed, but also with the technical partners was all boarded. And then initially it was the idea was that at least we are going at a certain scale where at least 18 districts should be covered in a phased manner. But then while this entire scheme was getting evolved over a period of time, the state took a decision where we will ensure that the THR manufacturing units will work in 2 shifts, and we will cover 43 districts, and we'll try to saturate the demand. Next. So based on this, just to give the snapshot, the entire idea of this project was in UP was to improve the maternal and child nutrition, and at the same time also ensuring the economic empowerment of the SHG women, so that this entire arrangement of decentralized take-home ration could become sustainable, and the distribution takes place in a transparent and a qualitative manner, and leading to the overall improvement of the nutritional status. So I will not go into the issues where Dr. Siddharth has already spoken about the nutritional aspects. So I will highlight the features which are key elements in terms of the project. So if you look, there is a strong interdepartmental coordination between Department of Rural Development and Department of ICDS and Women and Child Development. We have an MOU which is of 7 years duration. A long-term MOU is there, and for any kind of an issues and challenges in terms of resolving the conflicts, then there is a senior government officer has been assigned for arbitration and resolving the issues. Similarly, there is in this entire model, there is a lot of community ownership because the investments are coming from the side of the women. Almost 300 SHGs have been organized for setting up one THR manufacturing unit, and each SHG has almost contributed around 30,000 per SHG, and likewise they have made a capital investment of 90 lakhs for setting up one THR manufacturing unit. There was, as part of the arrangement, the working capital has to come from the Department of ICDS. So upfront advance of 2 months was also ensured as part of the MOU, which was concluded between Department of Women and Child Development and UPSRLA. Third important element is to ensure that the work is being done in a standardized manner. So basically, a robust capacity building on production and quality control was taken up with the support of the technical partners, and rigorous training of SHG women was there was special emphasis was given in terms of identification of the women who are going to work on these THR manufacturing units, because the women are supposed to work in 2 shifts. So all those have been further. A lot of compliances in terms of which are required for ensuring that the SHG women should be able to run this business in a more professional, and should be able to meet the food standards, food gate standards. So we have these legal compliances were ensured in terms of FSSAI, GST, PAN, registration in Udyog Aadhaar, and other compliances which are required for ensuring the production. Similarly, 20 women, I said that they work in these plant in 2 shifts. One shift is of 8 hours. We have an installed capacity of 2.5 metric tons, and when they work in 2 shifts, it's 5 metric tons of installed capacity is there. THR units which are installed, they were for ensuring the standardization of the machines and equipments which are required. So as Dr. Siddharth mentioned, initially the 2 plants were set up with the support of technical assistance of WFP and the financial assistance. And then basically we supported state in floating the entire tender process and onboarding of the 3 vendors, and then ensuring that the 3 vendors have a standardized equipments, and they were responsible for setting up and commissioning of these THR manufacturing units, and we provided the monitoring and the technical support in terms of ensuring the quality and standardization of these. Similarly, important element as mentioned by Dr. Siddharth is that the state has worked on the recipe reformulation and increasing the uptake of the THR. So both initially the current recipes which were being produced and supplied, their also uptake has been very positive, and where the studies were done both by the PCI and WFP, the results have been very positive, where the beneficiaries have appreciated both in terms of taste, in terms of the palatability of the recipes. We ensure that whatever the THR is being produced and supplied, it gets tested by the enable labs which have been empaneled by the mission, and all quality concerns are assured before ensuring the supply of the THR. For some items, because not all items commodities are available at the local level, there is some centralized procurement is done with the support of wheat, SMP, and skim milk powder, and vitamin mineral premix and packaging rules. This was becoming a little bit of a challenge in the initial stages, so we went ahead with the centralized procurement of these commodities, and rest of the commodities are locally purchased, for which there is a committee which is responsible for ensuring the quality standards in the project. The important feature is there is a lot of ownership from the side of the government of UP, and despite because the THR which was being produced was according to the cost norms which were issued in 2017, and the indexing with the inflation has not been done, and because of that the rural women which were involved in the production, the cost of production was going high. So whatever the gap was there, so government agreed to provide a 262 crore viability gap funds, for which a proposal was jointly prepared with the technical collaboration of the agencies, and this was submitted to government. And then we have a unique feature where there was a Government of India scheme where Ajivika Express was providing to the SHG members, and there was an internal convergence within the groups who were operating the Ajivika Gramin Express. They were engaged for distribution of the take-home ration to the Anganwadi centers. And lastly, this all initiative which was going on, this has also further been supported by the DRE initiative, and almost the decision was taken that to power these THR manufacturing units, apart from the grid supply, we should also reduce the use of the grid supply, as well as the use of DG gensets, which are were being used in case of the erratic supply from the grid. So solarization has taken place in an extensive manner, and basically initially 3 solar plants were piloted by PCI, in which 100 kilowatt plant was set up, and then 75 kilowatts was set up, and 66 kilowatt was set up in Varanasi. So in three locations the PCI has done this. So in terms of the outreach, if you look into it, there are 43 districts which are being covered. You can see the map which is there on the slide. And in this, you see on an average 3 to 4 units have been set up in each district to ensure to cater to the demand of the rural demand which is there. As of now, 98,000 Anganwadi centers are being covered. 6 lakh women have come together because 300 SHGs are involved in setting up of one plant, and as likewise there are 204 THR plants are there. So more than 6 lakh women have come together as an equity holders. And we have 1.15 crore eligible beneficiaries as part of this initiative, which are being supplied take-home ration. The key strengths of this initiative that we see is that, first of all, it's a very localized nature. So the women which are there at the rural level, their family relatives, their their members like pregnant women and children, they get the THR from the Anganwadi centers. So there's a lot of sense of ownership, and while discussing with the women, they say, this is the food that we are supplying, so we have to ensure the quality and control and everything. Similarly, these enterprises are not being owned by the women, so they are the owners of these women. So there is a lot of excitement around it that we are doing this business, and whatever the earnings are coming, this will be shared between the women. Similarly, this is a very good initiative around where there is a public procurement arrangement between the two departments. So the demand of one department is being catered by the another, and the revenue is being shared instead of which is going into the market. I've already mentioned about the strong government ownership, and this model is basically now it's a proven model where we have demonstrated that the women have the capacity to ensure the production and supply of the THR with a quality standard. So this model is very much scalable, and now the government is also considering that to scale the model from 43 districts to remaining 32 districts. So these are the 5 categories of beneficiaries for which the THR is being supplied. For children between 6 to 3 years, we have 3.1 kg, which is to be supplied for a month. Similarly, 1.25 kg for children between 3 to 6 years. And for pregnant and lactating women, it's almost 3.75 kgs. And for adolescent girls, it's the same. And for severely underweight children, severely malnourished children, we have 4 kilos and 625 grams, which is to be supplied in a month. For adolescent girls, we are only supplying as of now, as per the ICD's guidance, in the aspirational districts. But for the rest, the ICDS is not going ahead as of now. Thanks. So these are some of the recipes. As Dr. Siddharth has mentioned, we have jointly worked together on these recipes, and you can see the difference in the color coding and other thing. And even we have ensured that these recipes, there is like how to cook these recipes, ready to cook recipes. There is almost a kind of a prescription is mentioned, and steps are mentioned on how to cook these recipes. Similarly, if you look into the different recipes, we are giving one sweet recipe, atta besan halwa, to children 6 months to 3 years with a daily serving size of 125 gram, and the cost norm for which is 8 rupees as per the ICDS. For pregnant and lactating women, it is 150 grams, and 2 kinds of recipes. Say one is sweet, the other is savory, and the cost norms is 9 rupees 50 paisa. And similarly for children aged 3 years to 6 years, if you look, the same recipe is there. Only difference is in terms of the serving size, and the cost is 3 rupees 50 paisa. For severely malnourished children, this energy dense halwa is being given, which is almost 185 grams, and the cost norms from the ICD side is 12 rupees. These recipes before were actually approved by the NIN, and WFP has worked on these recipes along with other technical partners. And similarly, we have jointly worked on improving the entire packaging and appropriate messaging, which has been put up on these packaging THR packets. This is the organogram of the institutional architecture, how the women have been organized, the SHG women. So as I mentioned, the 300 SHGs have come together to form an association of person, and each SHG has contributed 30,000. So 90 lakhs has been raised by these women. within the institutional architecture, we have a representative body from the SHGs. So all the president of the SHGs, they become the part of the representative body. And then we have a management committee from this representative body and a procurement committee, which is responsible for ensuring. So the SOP and the guidelines with respect to the procurement and other things, management has been already been issued from the side of the mission, in which the technical partners have supported. So how this 90 lakhs is being used is basically 73 lakhs 16,000 is the cost of the plant and machinery for setting up. The electricity collection is 5 lakhs and genset is 8 lakhs. Stabilizer cost is 2 lakh 60,000 and other civil works is being used for 1 lakh 24,000. Next. These are the machines, different kinds of machines which are set up as part of the THR manufacturing unit. So we have a de-stoner, we have a roaster, we have a coaling machine, storage silos, auto weighing machines, blender, vibro shifter, hammer machine, and packaging machine. So these are the functions. Like the cleaning de-stoner is responsible for basically removing all the foreign materials like stones and other things, which is there when the raw materials are brought to the THR manufacturing unit. And before starting the, so this is used for cleaning purposes, the de-stoner. Then we have a roaster. Once the food grains are clean, they are sent to the roaster at a certain temperature and for a certain duration. The grains are roasted. After the roasting, then they are passed through a cooling machine, which reduces the temperature of the roasted food grains, and then they are stored in silos. There are 3 kinds of silos in which we store chana, moong dal, and your wheat in 3 silos. And after that, based on the below the silos, we have the weighing scales based on the recipes. The ingredients are taken into the weighing scales, and through an elevator shaft, they are sent to the blender, where they are sent to basically the hammer mill for converting into a powder. And once it is converted into a powder, then it is sent to pass through a sifter, and then sifter, after ensuring the microns and granules which are required in terms of the powder, they get into the platter, where the fortification takes place by putting the vitamin mineral mix, and then it is sent into the automatic packaging machine. And then once it is packed, then they are stored in the bags of one gunny bag, where 10 packets are kept in one gunny bag. So as I mentioned, there are 2 ways of doing the procurement. One is the centralized procurement. For wheat, the procurement is done through food FCI, and which is the FCI is providing based on the allocation from the ICDS, is providing on a subsidized rate. We have packaging laminate, skim milk powder, and vitamin mineral, for which a centralized procurement through UPSLM has been floated, and the agencies have been empaneled for ensuring the standardization and the quality of products. The rest of the decentralized procurement, like groundnuts, chana dal, moong dal, soya bean refined, spice mix powder, salt, and sugar, these ingredients are actually procured from the local mandis by the women themselves. This is the production cycle of the THR. As I mentioned, it's about cleaning the grains, then grain washing. I've already mentioned the grain roasting. Then the cooling takes place. Then automatic weighing is done. Then pulverizing or the converting into a powders. Then the addition of SMP and oil and soil and spices is done for fortification. After the uniform belting, the packaging, then storage is done in terms of there are specialized warehouse have been converted. All storage using the all storage guidelines. These the finished products are stored, as well as the raw materials are stored based on them. And then samples are taken on the basis of the batch coding and then sent for quality testing to enable labs, and then the distribution takes place. These are the different micro nutrients or parameters on which the NABL labs does the testing, which includes both protein, fat, and calorie, carbohydrate, as well as the micronutrients which are tested in terms of dietary fiber, iron, folic acid, vitamin B12, mesophilic aerobic plate count, yield and mold count, coliform, E. coli. All these on all these parameters, the entire THRs is on the sample basis is tested by the NABL labs. We also have developed the THR-MIS application, which is basically to capture the end-to-end progress. So in this, once the DI is received, this is automated and digitized. Once it is done, then on the daily basis, whatever the production is taking place and the raw materials are being used. So once the procurement gets completed, then that gets digitized, and similarly the production and the electronic bills are generated through this the entire system, and this is helping us to actually ensure the monitoring of the entire project on a day-to-day basis. This is about the economic viability of the THR. So if you look from the point of view of the current existing cost norm, as Dr. Siddharth was mentioning, that there is already a work going at the national level for increasing the cost norm. So as of now, the THR units are incurring a loss of almost 1,35,000, but basis the technical proposal which was submitted to the government of UP, and a viability gap fund has been provided to the THR manufacturing units. Now almost 2,14,000 profit is being earned by the THR manufacturing units, and this is before the taxes that we have included. So in terms of green transition, this is an important aspect of the project, and one of the major challenges which was faced by, because when we were going ahead with the setting up the THR manufacturing units, and this has been done in a very short period of time. So the SAG women were not able to find the THR units which are actually close to the industrial area or an area. So some of the THR units have been set up in areas where they don't get a commercial grid supply on a regular basis, and it was observed that almost some of the units were facing challenge in terms of getting the electricity supply in the rural areas, and sometimes the electricity supply was erratic in terms of voltage supply was not adequate, and it was creating a lot of difficulty in terms of plan. So initially, as I mentioned, the 3 pilots were done by PCI by setting up 3 units in 3 locations of Agra, Varanasi and Unnao, where 3 different categories of solar plants were set up. And post that, the learnings and the basis of learning and other things, the government of UP and UPSLM has gone ahead with scaling up. And there is a unique, again, a leverage and which is happening between the 2 departments, where the food processing policy of 2023 of the government of UP is being led, where 90% subsidy is given to the SAGs, in which up to 75 kilowatt. So almost 30 units have now got the complete subsidy, and the remaining solarization is happening. Further, because while giving the subsidy, the government does not 10%, there is a gap of 10% which is required. So PCI through HSBC has leveraged almost 8.47 crores from HSBC and ensured that the SAGs are able to make the 10% contribution for leveraging this entire subsidy. And almost on the basis of this, the production has gone 1.8 times, and almost 3.5 tons of CO carbon emissions every month is getting reduced, and there is a saving of around 75,000 which is happening in operational cost. So these are some of the outcomes of this project that we have basis our experience. We have been there. So there is one local and regular employment that these 20 women are getting, and almost a lakh annual income is getting generated for these women, which is creating a lot of financial independence for these women. And there are a lot of stories of transformation and gender integration and gender equity is happening within these families, and this voice of women is getting improved. Similarly, it's a strategic partnership which has happened in UP, which has been unique because while we were going ahead with our initial studies in across other states, there have been a lot of challenges in terms of leveraging the funds from ICDS and timely payments from ICDS, but I think UP has been able to crack that nut, and the partnership has been quite successful in terms of and as of now more than 385 crores of payments have already been received by the SHG women. So further, this is also leading to a last mile connectivity where the THR production is happening on a decentralized basis, and women are able to, the beneficiaries are also able to visit these THR manufacturing units and see how the entire THR is being produced, and they are able to see how quality parameters are being ensured, and they are more confident in terms of what is getting produced, and that is also leading to improved acceptability of the THR. We are significantly, as I mentioned earlier on, that we are significantly impacting on environment sustainability through solarization, and and we have a long way to go in solarization of all the remaining 151 THR manufacturing units, on which already the work is going on. In terms of nutrition also, if you see, when we started this in 2020, and now when we look in terms of the number of SAM children which are being, so we see there is a 10 to 15% decrease in the demand or the request from the ICDS side for the SAM children. So we also see that it is leading to improvement in the nutrition. And as of now, what we see is that these SHG women have been able to produce more than 2.5 lakh of metric ton of THR, which has been produced, and for the on the value of this THR is almost 1395 crores, which has been supplied to ICDS. So so these are some of the outcomes, and some of the learnings have already been shared by Dr. Siddharth. So thank you very much, and happy to take the questions which are there from your side. Over to you, Manish.
Thank you so much, sir, for such an enriching presentation. Now the floor is open for question and answer. Please ask whatever questions you have. Yeah, please. Somebody please give the mic to Dr. Sonal. And also you can ask it, your question belongs to whom?
Question on model actually about the cost, and I get those additions well in that cost of the THR of 8 rupees and 9.5. So the like skim milk powder and all, how do you manage? Like it was the other things which helped with that, or how could you manage those additions within that 8 rupees? That was one of my questions.
So to answer to your question, the cost that we mentioned, so the recipes are not within the 8 rupees norm of ICDS. And that is what Mr. Adil also showed in his slides, that initially the plants were running into losses, but later on we developed a proposal for a viability gap funding, which was where the state government pooled in an additional of 262 crores, which then helped the units bring them into profit. And the additional cost that was required for producing of the recipes, that was sort of being met by the additional funding from the state government. So if we were to talk about the cost of our recipes, if ICDS gives you 8 rupees per child per day, the recipes that we are making, it costs us around 10 rupees or so. So that is where the state government additional funds that were there, so that helped us. Adil, do you want to add anything else?
No, I think you have aptly mentioned, responded to the question. So it was difficult for us to manage this entire cost, and for which the WFP and PCI worked together on the viability gap proposal, and we highlighted to the government because of highlighting why, because of inflation and other things, the costs have gone up, and there was also the impact of the Ukraine war, which started, and COVID when we started this entire project. So basis that, the government has given an additional cost of like for 8 rupees recipe, as Dr. Siddharth was mentioning, we are getting a viability gap fund of 2 rupees 12 paisa, and which is helping us to cover the cost of the entire recipe. And this 2 rupees 12 paisa also includes some margin for the women while we've calculated this thing to make this entire initiative viable and sustainable.
Yeah, any further question? Okay, I think there is no further question. So I'm really very heartily thank you for both our speakers for such an enriching session. Thank you for your talk. We have seen your take-home ration has evolved from being a simple, being a supply chain nutrition intervention to a multi-dimensional platform, driving women's empowerment, nutrition delivery, and community-based enterprise development. And I would also like to say the audience that I have privilege to work in the same project under guidance of Adil sir directly. I have we have, sit at the same desk, and I have seen the passion, the work, they have put in this project. So this was such a sensitive project also, political also, very big, because earlier it was running by the private sector. It's a centralized model, and one private party is giving take-home ration to the whole country, whole state. So we have did this whole project, obviously, the UPSR, SRLM team, WFP team, and under the guidance of Adil sir at the same time, they, did a big project in a very record time, I would say. So it was such a enriching experience working on that. Yeah, obviously. So thank you so much, sir. Thank you both of our, speakers for this very enriching.
Thank you, Manish, for your kind words. Thank you. Thanks, everyone.
May I now request Dr. Gulfam to extend our gratitude to Mr. Adil Abbas.
Adil sir, are you online? No.
Yes, I'm online.
Yeah. So actually, we reached out to the Secretary WCD UP for this model presentation, and ma'am very graciously, since she couldn't make it, she nominated Mr. Abbas and then the earlier partner, the existing partner, WFP. Both of them were invited. So we are grateful lot to the Secretary ma'am, this UP, TSU, or the overall project management unit there, the department, and Adil Saab, thank you so much for making it despite all the hardship. We knew he was supposed to come here in person, couldn't make it, then somehow managed to do this presentation. Thank you there. And thank you, Siddharth.
Thank you. Thank you very much, Mr. Gulfam. Thank you for the opportunity.
May I now request Dr. Ruchika Madam to... I request Dr. Usha Radi Madam to join with the guest. Thank you, madam. Thank you, sir. I also request Dr. Ruchika madam to extend our gratitude to Mr. Manish Jha. I also request Usha Rani madam to accompany the guest. Thank you, madam. Thank you, sir. Now we proceed with the technical session 6. May I now request Mrs. Priyanka Bajaj to take forward the sessions.
So, good morning, everybody. As we come to the last two sessions of the day, we have one very important guest as well as a very important session for the day. So, it gives me immense pleasure and honor to introduce this session on gender dimension of hidden hunger, mainstreaming gender in nutrition. We have somebody who's worked throughout his career, his life, on maternal child health, and who can know better the gender aspect of the health nutrition in the society. It gives me immense honor again to request Dr. Ajay Kheda, my mentor personally, an ex-commissioner for MCH in the Government of India, presently working as the country director of Engender Health. I think it would be really belittling the stature by counting on what he has done, where he comes from. He's a name everybody reckons with, everybody attaches themselves with. I take pride in being one who has been mentored by him, and it gives me, again, a lot of honor to request him to please come and deliver the lecture, sir. Thank you so much, sir.
Very good afternoon to all of you, and greetings to all of you on behalf of Engender Health. And I'm so pleased to be part of this national workshop. And I'm finding that so many nutrition scientists are really debating for the last 2 days, coming up with variety of strategies for improving the nutrition status in the country. And it is so impressive to understand, what kind of work they are doing in terms of, particularly in the field of food fortification, coming up with the innovative strategies, innovating testing approaches, and so on and so forth. So I have been, given a topic which is a little offbeat, I will call it, because since morning you have been talking about science, molecules, and kind of a testing, quality assurance. But we should all understand that here we are all, that ultimately we want to address the major public health problem in the country, that is the malnutrition. And malnutrition implies both macro as well as the micronutrient deficiency. And you just heard about the take-home ration initiative in the state of UP. That is an effort in terms of addressing the so-called the macronutrition. And we, I think last 1.5 days, we spoke about the micronutrient deficiency and how, we can tackle that, and which is being called as the, the hidden hunger, that is called as the micronutrient malnutrition. So the topic given to me is the gender dimensions. And as you all aware that, the health outcome of any interventions or the nutrition outcome of any intervention, they are not all dependent on the health interventions. I don't know how many people are aware that 50% of the success in the health is from outside the health department. If you improve the education of the people, if you increase the sanitation, if you improve water supply, if you improve housing, if you, do all those things, your health will automatically improve. So it is not that whatever health does, it is done by all health department. There are other departments who also contributes. And it is being called as the, in a common language, something called as the social determinant of health and the nutrition outcome. I actually consider health and nutrition as the one piece, because all the intervention which improves health and nutrition are more or less the same. So we are talking about a social determinant, and that is the gender dimension. Now, what we do is, this is a small presentation, and I know that gender is a very complex subject. It is not very simple. And also I must tell you that I'm not a gender expert. I'm a public health professional. But I have tried to understand the concept of gender and tried to put it into public health practice. Because generally I have seen, people when they talk about gender, they feel it's very complex, very confused. It's not my job. But if you try to understand, so in my presentation and in our variety of, kind of a training packages and the booklet which we have designed, we have tried to demystify gender, how to make understand much better, So what I do is my presentation will talk about what is that gender nutrition gap and how can this be gender gap can be addressed through which is called as the gender integration, or some people also use the word gender mainstreaming, And then, I will also share some of those engender health, kind of a learning from the gender integration in nutrition with a special focus on large-scale food fortification project. We are really grateful and thankful to the organizer for inviting and also for being Engender Health as an important partner to this whole large-scale food fortification project, which is being implemented by a variety of implementing partners and supported by development partners. And I will also try to enlist variety of opportunities and the actionables for gender integration, and then what is going to be the next step. If you go through this particular slide talks about the kind of a variety of data sets which are available, which broadly indicates, I'm not going to read the complete slide, but the summary of this is that there is a marked gender differential noted in the nutrition status. I think you will all agree. Since yesterday we have been talking, we are finding anemia to be 60% in women, 20% in the males and the boys. Even similarly, for the undernutrition also, you find 25% undernourished women. And if you look at the men, it is maybe around less than 10%. So I think there is a marked gender differential, which is clearly visible. And there are a variety of data sets, various national studies. And the last data which is quoted is the NFHS data, which also gives a big difference between the 57% and the 25%, and then the 59% anemia among the girls and the 31% boys. I think there's no doubt. I think we will all agree that this problem exists. That means if this problem exists, we have to do some kind of action has to be done. And as a step one, generally as a public health professional or a programmer, you will always first try to find out why this is happening. What could be the reason? Because difference is not, this is very significant difference. Why this is happening? So if you look at, this gender nutrition gap, here, we have tried to depict, three broad areas of concern. And one, obviously, there are biological factors. There are socio-cultural factors. And even there are factors which are called as the systemic factors. So all three factors really are contributing to this so-called the gender differential in the nutrition status. And if you go through these biological factors, I'll just quickly share some of those important things. Because of the women and the adolescent girls have the unique nutrition need, and then this period requires increased nutrient intake because the growing period. And adolescent girls also face added kind of risk, particularly menstruation. And another the important aspect which we should not ignore, which we must remember, something called as the early marriages. Early marriages often leads to early pregnancy. And if you will be shocked to know that in India, around every, I will call it, every fourth woman in the country is getting married before 18 years of age. The early marriage rates are around 23 to 25%. And 25% means every fourth woman, right? But in the last 10 years, there has been a significant change. This percentage used to be 50%. Every alternate woman in the country used to get married before 18 years of age. I mean, that was the state of affair 10 years back. We have moved forward. Now it is 25%, but still 25% is a huge number. Just try to understand the whole country as a whole, the remotest part of the country, and we are talking about, making a dent at the national level as a public health professional. We want to reduce the anemia level. We want to address malnutrition. Unless we look at those components. And then, pregnancy during this stage forces their bodies to compete with the growing fetus. And as you know, that adolescent pregnancy means like, baby giving birth to a baby, which is also quite a common thing. Roughly around 7 to 8%, adolescent pregnancies are happening in the country. And if you convert them into numbers, roughly, they comes to around 2 million adolescent pregnancies are happening in the country. And which certainly leads to malnutrition, anemia among the women, and then it further goes on to the children, newborns. So it's a vicious circle, We have to break that cycle. Then the postpartum period, childbirth, and then there is the interlinkages between the maternal and the child nutrition. So these are the kind of the, that's why this vicious circle of maternal and the child undernutrition cycle is going on. We have to break the cycle. Yes, science will do its own I think, whatever science can do, but there are some kind of, surrounding factors. They also need to be tackled simultaneously. But you might say, as a nutritional scientist, what can I do? That's not my job. That some other person will do. So I will try to tell you that what, we can do as a nutrition scientist or a people working in the programs, what they can do. And then these are the socio-cultural factors and I call, gender inequality. This is one of the root cause, which is called as the, power imbalance. And power imbalance happens at the family level, at the community level, at the workplace, at the railway station, at the airport. This, gender inequality really happens across every sphere of your life. And this is, one area which is the root cause for this gender differential. And this inequality, manifests in the form of a harmful, gender and social norms, practices, and this all limit, access to the nutritious diets. And even it also impacts your, access to the essential services. I mean, women do not have the autonomy to go to the health facility to take treatment or avail nutrition services because she is not empowered, She doesn't have, financial autonomy. She is dependent on somebody for a decision making. She will have to ask whether I can go, I have a problem. So there are, kind of challenges even in terms of availing services. And then obviously it restricts, individual autonomy to make decisions, even big decisions like marriages. Decisions are made by somebody. She may not be mentally prepared, but they get married, And then the whole life goes into that circle of, malnutrition, poverty, and then the child nutrition, and it goes on. And then, another important point to note is, both nutrition and the gender inequality, they are quite closely interlinked to each other. One reinforces the other. Because if there is a malnourished, woman, the girl, what happens? It lowers their learning potential. If there is a woman who is malnourished or anemic, her learning potential is reduced. And once the learning potential is reduced, she doesn't have that employment opportunities. Because she has not studied, because she couldn't study, because she was malnourished. And then she goes into that circle of, that malnutrition, gender inequality, and then this circle goes on. So that's why I said, gender inequality and undernutrition are mutually reinforcing. And then, there are number of, systemic factors, which are, they are the women and the girls, nutritional vulnerabilities are deeply rooted in the systemic gender inequality that operate across policies. Even the policy maker forget about it, the gender issues. The institutions, the program delivery systems also, they don't take into consideration. I know that nowadays people keep talking about, if you talk about the workplace, now I think the women are more coming into the workplaces. But the whole system of, this so-called the job, 9-to-5 job, system was designed many years back, keeping in the back of the mind that women will take care at home and then the men will go and work outside. Still, we are still following that 9-to-5 system, which becomes really challenging for a woman who is pregnant or have smaller children or have responsibility for caring for the elderly at home. So it becomes a challenging thing, So there are kind of a gender-absent policy designs. They lack gender analysis, resulting in interventions that fail to acknowledge and address the specific needs of the woman. Our policies are not made in that fashion. So one has to think. But something positive has also happened in the area of nutrition, which I will like to share with you, that in this space of nutrition, particularly for the ration shops, fair price shops, the woman has been declared as the head of the family. I think this is a marvelous step in terms of policy direction, positive policies towards nutrition, that the woman has been declared as the head of the family. On a ration card, the woman name is written, That means if she moves to another place because of some personal reasons, she will be able to draw that ration. So which is a very positive thing, And then, there are like, program access barriers, like mobility, which I told you. Then there is a time poverty or time burden. And then the low literacy levels are often overlooked, limiting women's ability to benefit from the services. Because sometimes, we prepare some kind of a SBCC, IEC materials, which are very text heavy. And then, as you know, that the large number of women are illiterate. They can't read that, So that means whatever interventions or whatever investments you are making to improve their knowledge, they can't read it. So ultimately, your investment is getting wasted, and it is not showing the results. So that means while designing even the SBCC, you must take into consideration the social background of the community, and particularly the women, because they are the vulnerable population, And then there are institutional biases, The frontline workers, implementing agencies, they also replicate the gendered assumptions and the discrimination. Like generally what happens if the couple, come to a health facility, for example, you might find that the doctors will, speak to that man and tell her that your wife is suffering from this problem. So generally, because people who are in the health system or people who are working in the system, they also gender bias, They think, इस औरत को क्या पता होगा मतलब. Better है कि उसको बता देते हैं. So I mean, those kind of, biases are also there in the health system as well. And even other system, the whole social system bias, because we also belong to the same community. So I think we also need to address those issues of, institutional biases, which are not conscious, but they are unconsciously, communicated. Now, this is the slide which I really wanted to, share with all of you. That if you really want to address gender nutrition gap through gender integration, so what is gender integration, Gender integration involves, activities that take, gender norms into account and then compensate for the gender-based inequalities. This is the statement, if you remember, I think you'll be able to understand the whole crux. And then the second important point when you talk about gender integration is, this also involves, challenging the unequal distribution of the power and the resources, opportunities, benefits, and thereby promoting positive change in the gender roles, norms, and the power dynamics. So this second point, not only, it also pertains to the people who are working in the laboratory, people who are the scientists, working in the health system, working in the, let's say, ration shop, Anganwadi workers, they must be able to challenge those unequal distribution of power. First, identify what is that unequal, power imbalance which is seen there, and accordingly, you have to address those things, And there is a potential for gender integration, at the programmatic level by systematically integrating gender equality and the inclusion perspective in designing a program, while implementing a program, including SBCC, and even the M&E indicators, which are there for the program, they can also be designed. Because what happens, the M&E indicators are so critical Because it is always said that things, which are monitored, they are done. If they are not monitored, they are not done. Like, you are conveying some kind of a messages to 100 people, And and generally you find the reports are 100 people attended this SBCC, kind of a messaging workshop in a village, But unless we know their gender differential, we will not know whether this information is going to the vulnerable population, women or not, There might be 100 men may be there, and there may not be any women in that group, So that means you have to see that your SBCC implementation programs are getting implemented and successfully been taken by the partner, by the vulnerable population. And then, there are examples like improving women's access to the nutrition safety net program, information on the benefit of the fortified nutrition, and greater workforce participation in the food program. This work participation is also very important, because more work participation will also empower women. They will make them financially empowered, So those things are really very critical, Now, what I am now going to do is that now, I am moving, from that gender rhetoric to the so-called the transformative actions, What are those transformative actions, So I'll be sharing, some of my experience of Engender Health, that what we did while working in the project. This was a gender integration in the nutrition project, where, we carried out a gender analysis. We tried to build capacity of these gender master trainers. And then we also tried to do, gender integration in the work plan and the M&E. And one of the important thing which we did was we did the complete mapping of these stakeholders in the ecosystem. Who are the players who are working in this field of food fortification? We did that mapping and then tried to understand, interacted with them, and tried to understand what is their understanding about gender sensitivity, about their knowledge and the awareness. And then the shocking thing was that majority of the people who work in the system, they have no basic understanding around those gender issues, And they think it's not their job, It is some other's job, So then we also made a project advisory group, and then we also, gender analysis was done to understand the link between the gender and the nutrition needs. And then we gathered a lot of insights, What are those enablers? What are those barriers at various levels, I'll give you one example. We were visiting NIFTIM, for one of our field visit, and we were surprised to see that, machines which are made to do the food fortification, they are not women-friendly, because those machines were made keeping in mind that the men will be the person who will be handling those machines. These are very, very small things, but, one can always take into consideration that we have to keep in mind the women can also be in the workforce. So our machine also needs to be a woman-friendly machines, Maybe similarly in the laboratories also, woman-friendliness. So those are the kind of the opportunities and the barriers, And these are the kind of we looked at the work plans, we looked at the M&E research, we looked at the IEC, BCC, we looked at the procurement, we looked at every entry point in the large-scale fortification project and tried to find out what could be the barriers where some intervention can be carried out. And I'll give you with some examples that what kind of intervention we did, So because one observation which was noted was that there was a lack of sensitivity, lack of capacity building. So we did a capacity strengthening of the stakeholders, our technical support units, and the representative from the development partners. And we also conducted a sensitization workshop for the food industry and the government at the state level. Then, we came up with a booklet which is called as the Gender in Action booklet, This is a very simple booklet which has tried to demystify the concept of gender, And this handbook is meant for the program managers, field staff trainers, and this can be used by program managers at all levels, And a similar note, we also came up with the gender knowledge product in the form of a self-learning module, which was a gender digital kit was also prepared, where, one can do a self-learning around gender issues, Instead of reading, big books on gender and trying to understand the concept, this simple digital gender training module can really help you in understanding what are those issues, what are those entry points in the program where gender can be integrated. And this is a course which has been co-created by the technical experts, and it gives, relevant examples from the India, the case studies. So you can go through it. This is available online. And then even we also came up with, gender integration in the work plan and the M&E. We developed some guidelines. Similarly, we developed some guidelines on the IEC and the BCC. And I'll give you, some of those examples, And these are the, opportunities and the actions for the gender integration. Now, these are, some of those actionable one can think of. I've given you a few examples. Like, you can think of, preferential, procurement from the women farmers and the women-led producers group to improve their market access. You can also think of, promoting the inclusion of the women entrepreneur and women farmer in the food fortification manufacturing. You can also promote, women workforce participation in the skilled jobs, maybe in the laboratories, maybe in the academic institutions, one can promote, and even audit and support the enable gender-sensitive and inclusive workforce, and review functionality of the government-mandated policies, such as the POSH and the grievance mechanism, and, support gender-sensitive provisions, like, to engage women in the shop floor roles, provision of, breastfeeding corners, creches, toilet facilities in the factories, and designing, women-friendly equipment and the tools, which I just shared with you. One can think about designing those kind of tools, So these are, some of those actions one can think of within your own workplaces, within your own work environment, So which could be called as the gender integration. And then, this is an example of a communication material. If you look at this communication material, we call this as a gender blind material, Because here what you're finding, here you find that the woman has brought the child for immunization. That means here we are trying to reinforce that getting the child immunized is the job of the woman only. So that means, we are reinforcing so-called the gender norms and the gender practices. So that means if you try to develop a poster where both husband and wife are there, so men will also think it is also my responsibility. So these kind of material could be avoided, and we call them the gender blind material, And similarly, this is the material which I found in one of the, the place in Gujarat, where we find, both men and women have been shown, and they are showing equality in every grain together we sustain, Now, these are, some of those suggestions, which have been written here based on our understanding, and there is a separate guideline also available, And one of them is the, ensure females and the male representative in ways that challenge gender stereotypes, and then the inclusion of the marginalized identities. Gender equality is a key dimension of nutrition without raising gender awareness, and use language and the images that do not perpetuate discrimination. One has to avoid those languages. And then women in lead as the knowledge holder in senior position. Generally you find, the male person is giving an advice, rather than a woman is giving advice. So while designing a poster, you can always position, women in the role of a knowledge holder. And then obviously less text heavy, and then, gender audit of the language, medium, and the method is also very important, So these are, some of those suggestions, and these are the variety of the posters which talks about, where is the, kind of a gender stereotypes are being reinforced, which one can, avoid. And then within the M&E indicators also, there is a possibility. Even in the research, the surveys, one can do, and gender indicators can be captured using either quantitative or qualitative methods. And then they can be in the planning, budgeting, or in the capacity building. Like for the capacity building, percentage of intervention sites, capturing gender disaggregated data in the training activity report. Because generally we don't write how many people trained, 20 people trained. But if you write out of 20, only 2 were girls, 18 were men. So we know that the information, the women are not participating, And then similarly for awareness campaign, I already gave you an example that proportion of males and the females reach through the nutrition and the food fortification awareness campaign. So these are, some of those experiences which I thought of, sharing with you in terms of how can, one can think about gender integration. And if you go through, the various training material, you will be better informed and you'll be really able to introduce gender integration within your workplaces. Now, this is the kind of the way forward, which we are proposing, that we are proposing to work closely with the PMU for the strategic engagement with the key stakeholders at the state level and the technical support units, including government testing laboratories and industry for driving interest. And we propose to establish a center of excellence of nutrition and gender, build some gender champions, engaging with the academic institutions, and contextualizing GYSI markers in the nutrition food fortification system, and including the research activities, and then the strength and community level engagement. So these are some of those thoughts as a next step, because this is the area which we have recently entered. Historically, we have been working in the space of gender in the field of reproductive health, where there is a gender plays a major role in terms of family planning decision making. But I find that nutrition also has a lot of scope and a potential for integration. So with these few words, I stop here and thank you very much for this opportunity. Thank you.
Thank you, sir. I think with that, we open the forum for questions, if any, to sir.
Complicated, hai na? This is a complex subject. Okay, then thank you very much, everyone. Thank you.
So no questions reinforces my thought that it is too complex a subject, that not only I fail to kind of get much every time I get into it, but I think everybody is the same. That makes me feel that it's even more important to have such sessions and such engagement between the community, individuals, and more for males to understand that gender is something that we need to talk more. Thank you so much, sir, for making such a complex subject look as basic, at least when you talk. We have had that experience and advantage of listening you again and again. Thank you so much, sir. With that, I think we come to the close of the session. Thank you.
May I now request Dr. Mona Duggal Madam to present a memento to Dr. Ajay Kumar Sir as a token of our appreciation. I also request Dr. Gulfam Sir to join with them. Thank you, sir. Thank you, madam. Let us now proceed with the deliberation and recommendation for way forward in LSFF. I request Ms. Priyanka Bajaj to take over the session.
A very good afternoon, everyone, to all the respected dignitaries, colleagues, and friends. So we've finally reached the session, where we're going to deliberate on what we've learned and how to take things forward from here. And here I remember the quote from John F. Kennedy, that the time to repair the roof is when the sun is shining. And I think from the last 2 decades, India has been working a lot towards managing hidden hunger, and we are preparing. So let's say that the sun is shining and we are preparing to deal with this challenge, and hopefully we will be able to resolve this challenge at this point in time very soon. So, this session in the roadmap ahead, the idea is to not just to summarize what we've heard, but also reflect that where do we go from here. And for this purpose, what we're going to do, we're going to have a panel. Majority of them are the dignitaries who've been there for the 2 days with us. And there will be few new who will join, and they're going to reflect on how we take things forward from here. So for the panel, we have, I would like to first of all invite again Dr. Ajay Kheda to be on the panel. So please join. Next is Dr. Mona Duggal. Ma'am, please, if you can join the stage. Professor J.K. Sahu. Also, we have, somebody new. We have Mr. Mohan HL, Chief Executive Officer, KHPT. He's a renowned social scientist with over 3 decades of grassroots experience. Mr. Mohan is a passionate advocate of community-led development and decentralization. At KHPT, he has driven innovations in maternal and child health, HIV/AIDS, and adolescent health, and have forged strong partnership with government grassroots networks to ensure that communities themselves are at the heart of development solution. Also, we have one last panelist, and the most important one, Ruchika Sachdev from Gates Foundation. She'll also be joining the panel. Yeah, please.
We'll take the podium up.
No.
No, we need for next program.
Okay.
We'll do it once for all.
Okay. All right, so how we're going to go about this panel discussion is that I'm going to open the floor for our panelists, and we're going to check with them that over the 2 days what we have learned, and based on their expertise, what are their suggestions, how do we take things forward from here to further strengthen the interventions that are taking place for the hidden hunger, and especially for the large-scale food fortification. And after that, what we want is a deliberation within the audience, especially from those who've come from FCI, and trying to understand that how do they see that, the challenges that they're facing, what are the kind of things that they want the community to do at large to support them and the program. So to begin with,
Priyanka, I just want to flip around.
Okay.
Because,
Okay.
Let's do bottoms up, since
Okay.
we have colleagues from
Yes.
FCIR there, and they're working day in, day out
Yes.
with the supply chain actors and with the consumer. Maybe if you could ask some of them representing the 3 states, top 2 challenges they see which needs to be solved, and then maybe we can come up with a deliberation.
Sure.
So let's use the bottoms up approach.
So Rajan sir, if you can come up and tell your thoughts first of all, and then we'll have somebody from Telangana, from Andhra as well, please.
From Andhra, yeah.
Okay, sure, ma'am. Sure. Can we have a mic? Ma'am, if you can come here.
Good morning, ma'am. I'm Triveni, Manager QC from FCI, Telangana. Basically, I want to share my own experiences here. My sister is HM in government school, where MDM is implementing. One day she called me, some plastic rice is there in rice. My cook was removing it, washing all those one. Previously, it was not there. Now only it is, we are facing this problem. What it is, she asked me. when FCA is supplying, emblem is there on the bag, FCA. So she called me. So I asked her. Resin slip was there on the bag, stitching on that one. Otherwise, any resin slip was not there, she told. Then you see on the bag, plus F mark will be there or not, I asked. So she checked, then she told, plus mark F is there. So I told her, this is not the plastic rice, this is the fortified rice, which is supplying by the government of India, but you are not informed or educated by this one. So you tell to your friends who are along with all schools. With authentication, I told. My sister is working in FCA. She told this is fortified rice. Nobody will believe. Some people may believe, some people may not. So education and information is first they have to give, then only this rice should be supplied. One point. Another point, when I worked in Chennai, there is also, we used to go for IEC programs. There also, HM told, we are giving the food, fortified rice for all the children who are coming for Anganwadis or schools, midday meals. But what about us? We are not getting fortified rice, where we have to purchase. We also want, no, not only the poor people. We also want, where we will get. I told them, some sachets are there, but it is not available in all department stores or any. Some high-level stores you will get. But madam, we are unable to get those one. Please tell me where it is available. So we have to, we are in a house, mother will prepare recipe. We are doing that one. Feeding is not given properly. So we have to educate all the people, and for we are targeted TPDS people only, we are supplying the fortified rice. Remaining, we are not given. Any public publicity is not there. Where it is available, we are not giving. So we have to be feed properly to the consumer also. That is my opinion, ma'am. Please, one more thing also I will add. We know Mukesh had in every cinema, movies starting. If you give likewise one fortified rice ad also, it will reach the bottom of the pyramid, then they will get this one. This, what happened 2 years back, my sister asked. 2 days back, we went to Kaveri Emporium. Their saleswomen are there. They are also asking. By our language, we are not from Kannadiga. So they asked, where you are from? We told FCI, Hyderabad. Then this discussion came. Then also our Rajan sir given lecture there itself. Likewise, people, still 2 days back also they are telling that is plastic rice. So it is not reaching the bottom of the pyramid. Who are taking that one? Still, that awareness should be created up to the bottom pyramid. Then we will successful when it reaches the consumer. Now we are preparing so many. In 2 days, we came for training, how to trace check that one, and all we have learned. But it is not reaching the actual consumer. So they are not taking care. 48,000 crores we are spending. But maybe it is not, that much impact is not creating and awareness of. Please, awareness, on that awareness part, we will concentrate, then we will get more results. Thank you, ma'am.
Thank you so much, ma'am, and that's really helpful to understand what should be done, especially in the area of creating awareness, and not only probably for those who are, receiving the PM portion or at the Anganwadi or PDS, but overall kind of later on thinking that how everybody has access to fortified rice. That's a very good point, ma'am. Also, if I can request the representatives from FCI Andhra, if they can come up and share their thoughts, please.
Thank you, ma'am. Myself, Dr. Ram Prasad. I am working as a manager quality control in Food Corporation of India. I am representing Andhra Pradesh, but I am from Port Blair, Andaman. From all the way to Andaman, I came here to enlighten my knowledge on these fortification programs. Basically, when the government introduced this fortification program, I was a little bit skeptical because I was a little bit scared also. Why government is doing all these mess and all, like mixing the nutrients with the rice. One side we are giving more polishing to the rice, other side they are mixing the rice, everything and all. But after I came here, really I was my knowledge got enhanced, and this is very important, the fortification. Based on the data, what they have shown till from past 2 days, really it is required for the India. And also, what I observed is, the presentations what they make here is really a nice presentations, and from those presentations, I am getting so much of knowledge, so that now I can go to my place, and whenever I am conducting any IEC programs, I can explain each and everything to the local people in a local language, so that they can understand very well this IEC, what is this called, the fortification program. And the important thing here I wanted to tell you to the panel is, from FCI, we are facing some problems, ma'am, regarding especially the fortified rice. If the scientific panel is there, because we are facing in a problem of blending ratio. While checking of the blending ratio, we are getting varied results if we are person to person. The same sample, if you are given to this different persons, we are getting varied results. So we don't have a consistent method for checking of this blending efficiency. So we are checking the blending efficiency physically only by picking the fortified kernels from the grain. Rather than picking the fortified, because now I have seen in the outside, they have blending efficiency test rapid kits are there. And I have wondered that the fortified kernels which are having nutrients and not having the nutrients, both are kernels only, fortified kernels. But physically we cannot distinguish that the kernels which are having the nutrients and the kernels which are not having the nutrients. But only the chemical way only we can distinguish through rapid tests whether the really quality kernels are mixing in the fortified rice, so that we can really test the blending efficiency, so that the real outcome of this program will reach to the public and the ground level. Because India, we are producing and we are procuring lakhs and lakhs of metric tons of fortified rice, and automatically the system will be there. We can say the spurious qualities also will come. So in part of quality assurance programs, so if we are adapting this type of rapid test kits in the field also, this will be useful for us really, whether the initial stage itself we can identify that the supplier is giving a good quality kernel which is having really the nutrients or not. Then the quantification part will be later, how they are really, means like how much amount of nutrients is there and all. The quantification part next it will come. So that will be a really good thing, ma'am. Good thing the organizers. And one more important thing is, while testing the fortified kernels as well as the premix. So my question was in regarding the premixes. I have a doubt, because in vitamin B12 especially, the vitamin B12, we are not getting through the vegetarian sources. And we are what is this called, producing this vitamin B12 through a fermentation process by a bacteria and all. So especially in the fermentation process, the vitamin B12, for the getting of this vitamin B12, we are adding cobalt also in the substrate. So, but the premix, whatever the BAS specifications are there for the premix and the testing, the contaminants were not testing in the premixes. If you are adding that contaminants also in the tested of premix, the quality will be more, and we can get like a good quality of the vitamins as well as the minerals. That part I wanted to add. And really the thing is, next time, definitely and I surely say that whenever I am going for next IEC programs, I can, with this enlightened knowledge, I can enlighten the people. This fortification program is a good initiative of Government of India. Thank you. Thank you, Ananda.
Thank you so much, sir. That's quite a lot of things to capture back and answer, and I think our panelists will answer your questions also. And thank you so much for highlighting that it's important that all the messages or the right knowledge that we have here is translated into simple words and it goes to the public at large. Dr. Rajan, if you can come up and share your thoughts now. Yes.
Thank you, ma'am. Basically, I am willing to bring up the gap between the technology and it transfer to the end users. In fortification chain, it is being started from kernel manufacturers. Then it is coming to rice millers, and then to FCI, and it is ultimately going to PDS beneficiaries. In between, lot of agencies are there who are interested to check the quality of the kernels fortified rice. As we discussed in last 2 days, lot of technologies already developed, but it is not getting disseminated to the end users properly. Gap are there. In my view, FRK kernel manufacturers also need some training, because when we are seeing kernels being supplied are not matching exactly with the shape of grains in size and color. And technologists, research scientists may think over the shape of the grains also. In generally, in extrusion, grains are coming in round shape. But real rice grain is elliptical in shape. It is little bit flat. It is not rolling when it is getting dropped. But our kernels are easily getting rolled. That's why they may accumulate in a side of a bag or a heap of the grains. And rice millers also need to be trained how to blend it perfectly. Though the protocols are there, they have to check it on hourly basis. They have to keep a log book of that, quality checks. But generally it is not being maintained, as I seen at so many places. They also need to be trained on this basis, how it is important to get it checked each and every hours during the process of fortifications. Further, their machineries are not a state of art. So many millers have already installed the dynamic blenders. Their blending ratio is near to perfect. Even then rejections are there in their case also. And a small mills having no dynamic blenders. They are using the batch blenders. Batch blenders are basically, whenever it is blended, uniformity is not that much as the dynamic blenders. So policy makers may think over to give some support to them to install the dynamic blenders if possible. We have to think over that. Basically, technologies are there, but end users are not using because of the cost involved in it. So if we can support up to that level, that will be helpful in rice fortification process. Further, as already you had discussed about the consumer awareness, still a big gap is there. We use the latest technology, best quality of fortified rice. If consumers are not aware, if they are not eating it, then whole process will become futile. So basically we have to spend more and more on it to how to educate them, what will the better way to educate them. When we are seeing TV, mobiles, even visiting to the multiplex, I have never seen, as per my experience, any fortified rice advertisement is up to that mark about this cancer awareness, tobacco, not chewing tobacco, we have to not eat, and other things. Earlier those that pulse polio, like advertisement are not there today. We have to do advertise it more and more for the consumer awareness. And further, such type of training and seminars should be regularly organized, and end users plus kernel manufacturer, fortified rice manufacturers who are working in the field like FCI, civil supplies peoples, they should have to be involved such type of discussion. So the grassroots problem should come up easily. Through discussion, sometimes it may be formal, sometimes it may be informal, lot of things will come up so that new technology as per the need of the field can be developed. This is my request, and I hope some technology may already there, some provisions may already there, but we are not knowing that. So my request with the panelists to please enlighten over it. Thank you.
Thank you so much, sir. I think you've raised a lot many things which are of key importance going forward, and our panelists will also address all of them while they talk about the way forward. Do we have any other, representative who want to come up and say? Yes.
Respected dignitaries on the dais and off the dais, myself Naresh Kumar, Manager Quality Control, Food Corporation of India, Divisional Lab, Divisional Office, Visakhapatnam. Sir, actually, even though it is a repetition, just I want to add few points what my colleague told. Regarding blending ratio, actually I am having an experience of procuring some 4 lakh metric tons of FRK from 2019. And as a manager QC under the directions of our divisional office and regional office and higher offices. Actually, practically what we are facing the problem is regarding the wide variations in FRK blending ratio. First, at the time of inception of fortified rice, the kernels were flakes of rice. Now it is, we are getting the actual shape of rice. Main thing is, in a bag of 50 kg, if we are poking at the top and at the bottom or wherever, if I am analyzing, I am getting some 0.9. And my friend is analyzing, he is getting 1%. Same sample, if we are analyzing, we are having different values. Maybe that was due to the density of the fortified rice, other factors. Main thing, at the time of manufacturing of fortified rice and blending technology, if we are able to address this issue, it would be of a great help while procuring the fortified rice from the millers. Why? Because that is consuming a lot of time and energy. Why? Because we have to check minimum 580 bags consignment. So if we are getting less than the prescribed limit, we have to do it 2 times, 3 times, 4 times. On the other hand, supplier is he wants to push the stock to FCI. Why? Because he's doing business. For us, it is not business; it is service. So at the policy makers end, it is our humble request on behalf of FCI to address the issue And this is what I want to bring it to your kind notice. And thank you all for this enlightening session. Thank you.
Thank you so much, sir, for bringing out these points. Now, looking at the time and looking that there's a session after that also, and people have to leave also, if I can turn to the panelists and, based on what the participants have said and over the, the discussion over 2 days, if, I can request Dr. Khera, if you can just help us understand that how do we take this forward and what are the key things that we learn and, should be moving forward with and working on from here.
Thank you very much. I was listening the presentation since yesterday, and I've noted down few points which I would like to share with you as a next step. I'm not recapping because a lot of discussions have happened in terms of how to improve the quality. People have shared their experience in the field, what are the challenges they are facing. But as a kind of, next step to my mind, one of the point which is coming up repeatedly is something on, community awareness part, And just now I think many of these, the participants shared their thoughts and the experience, how to improve that community awareness. So I think this is one area where we need to have a kind of a holistic approach of community awareness, which needs to be put in place. And I will, at this point of time, will also like to mention one of the best practice in which I noticed. Somebody was making a presentation on the Bihar, I think Bihar experience, where you showed that cooking demonstration was the one initiative which really helped in improving the awareness in the community. And others like, maybe in the so-called the cinema halls could be another one. So I think community awareness needs to be built, That's number one. And secondly, related, the recommendations or the suggestion in the context of community awareness, I find that somehow, the health system is not, fully engaged in this fortification system. That's my personal feeling, Like ASHA workers or the A&M or the doctors sitting in the health facilities, or even the so-called the policy makers, bureaucrats sitting at the state level and the district level. I think it's high time, because I know that initially there was a beginning of the project. It was a pilot phase. But now I think fortification has been taken up as an initiative of the Government of India. It has been extended till 2028. And ultimately, what this fortification is doing, it is really trying to improve the health outcome, health and the nutrition outcome. So I think health department also needs to be engaged, needs to be sensitized about the safety of this product, the benefit of this product, and we have to create champions within the health system. I think that could be the third initiative which can really help in supplementing the efforts in terms of improving community awareness. I know that community has a lot of trust and a faith in so-called ASHA workers. They may not have faith in the Anganwadi workers, but they have a strong faith in ASHA workers, because ASHA belongs to that area and she interacts more frequently. That's number one, And then the second, the important point which I thought will be important to share with you, something which was discussed again, the UP model, I was quite happy to see that, because I know that the Government of India, the whole ICDS program is struggling to address the undernutrition in children. And we have not been able to make much dent, and people keep questioning the functioning of the Anganwadi system. People keep questioning the quality of the take-home rations and the leakages, and so many things happen. I think this self-help group model, which has been demonstrated as a success story, I think this should be disseminated, to as many states as possible, and then at least the states where self-help group system is strong, they can, take it forward. So I think that is the second suggestion. And then the third suggestion, which I noticed was, very little is being talked about this, folic acid. And I call, actually, folic acid micronutrient deficiency as a game changer actually, because it can really help in eliminating something called as the neural tube defect at a population level, and which is so unique, and it is not that we are talking about it. Globally, many of these countries have demonstrated elimination of folic acid, elimination of neural tube defect in the population level by introducing folic acid fortification. We are just talking about anemia and anemia in connection with the fortification. I think this is another good entry point, particularly when we are going to the health system, because they will find the immediate benefit of folic acid. And the interesting thing is folic acid supplementation is being talked about at the health department, but till today it is not being implemented. I mean, folic acid is given during pregnancy, but so-called preconception period, periconception period, there are thoughts, but it has not been introduced. There is a program for weekly iron folic acid supplementation for adolescents, but the coverages are challenging. So fortification as an entry point for folic acid could be another important area. And last but not the least, I will again like to reiterate something around being gender sensitive, being gender aware, and try to find out kind of a power imbalances wherever you are working within your laboratories, within your institutions, within your organization, and try to challenge and find out ways and means of overcoming those barriers and the challenges, so that we can at least boast that nutrition program is one program in the country, or food fortification program is one program in the country where gender inequality is being addressed. Although there is a potential for addressing gender inequality in every department, whether it is transport department or whether it is maybe agriculture department, but I think the nutrition, that has a potential, and you can really demonstrate that success. So these are the few points I noted quickly, but thank you very much for this opportunity.
Thank you so much, sir. So over to you.
Yeah, thank you very much. And I have a few points to deliberate. Sorry, I'm not a nutritionist, nor a researcher. But what I understood last couple of years, especially when it comes to nutrition in the government setting, I think the question for you all, I think you would have been seen for any of the programs in the government, there is a huge demand. But I have not come across anybody is asking about the nutrition. At the village level, at the district level, even at the state level. It is one-sided program. It is more to do with the supply. You go to Gram Panchayat. If there is no road, people demand. If there is no water, they demand. No electricity, they demand. But do they demand for a good nutrition for their children? We never come across on that. Why is that? I think the question is, any program need to be successful, there are multiple components. 3-4 components, if I have to remind, the problem identification, excellently done. We know. At the highest level, the deliberation, what is happening at different level of the micronutrient or the nutrition issues, it is excellently done. Lot of research organizations are doing that. When it comes to evidence generation, good. I think day by day the evidence is also generated. I am very lucky to see your presentation today. There are a lot of evidence they are gathering. That's a very good. But my question is, at what level? Is it that is happening at the grassroots level? Somebody was mentioning. Is the lowest governance level knows about this? The third one, part of the policy, again we are looking at the policy at the highest level. See, one good thing, we talked about NRLM, we talked about Kerala Kutumbashree or Jivika in Bihar, or you take Sanjeevani in Karnataka, or in different self-help group model, you can see 2-3 different things there. Unless your policy is articulated at the local governance level, any policy is only at the top level, people will get benefited. We have a tremendous advantage of having 73rd Amendment and 74th Amendment to the Constitution, where both urban local bodies and the rural local bodies have an independent power to execute these things, especially on the nutrition. But how, what is the effort? I think the answer for that is many of you talked about awareness. The awareness, according to me, at the lowest level of governance, if those people have, because they are the people are going to plan some program for their own community. So I think somewhere we need to change our model. For example, recently I'll tell you, with the support from some of the funding agency, we just piloted. We know that everybody was struggling after COVID. 3 areas are very, very important for us for the comorbidity. One is diabetic and hypertension, and also we wanted to drive out the malnutrition, and also reduction of the child marriage. These are the 3 issues taken. We just reached out to Panchayat and the Manrega. Within 2 months, through Rural Development Department, they are able to reach 10 million people screening at the sites with the Panchayat. I'm telling you, the strength is there somewhere. I am beating the bush in the Women and Child Department and the Health Department. So it shows me, unless these 2-3 departments comes together and anchoring department of the Panchayat takes the lead of it, it is not going to happen. How we are going to do that? I give one more example if time permits. Khera sir talked about the gender. I think that's excellent. I think I no need to explain about that. We tried a small study in Koppal district. NFHS 4 and 5, we have seen that reduction of 10% child marriage in that particular district only, because as he rightly told, in Karnataka also, 21% child marriage taking place. In Koppal district, it is Hyderabad, Karnataka region, most backward. We are able to see the reduction. Along with that empowerment process, we have seen 3 things changed. One is the age of marriage is increased, school dropout is reduced, their nutritional status also improved. Now we are analyzing the data. We don't have any very specific data other than health department. Teenage pregnancy, because that became a very big issue in Karnataka. It came twice in assembly. And we are analyzing whether there is any relation of this empowerment program with the adolescent girls have an impact on pregnancy as well. So what I mean to say, this kind of an empowerment has a multiple tier effect on that. The last one which we tried to understand bit of it, I'll stop with that. I always had a question when I'm working with the maternal and child health program in UP, Karnataka, all those things. What is this? Women are coming and registering 4th month, 5th month of their pregnancy, right? Nobody comes. Even if you go and do whatever bombardment, they'll not give, because it is a very, very personal issue when it comes to the pregnancy in a village mindset. So what is the answer about? Because you lost that 3-4 months. That is very important time, right? See what we should do. So we had some Agnita and all. We did one small study just to understand in Gulbarga district, that is again most backward district. How many women will deliver in the first year of the marriage? 62% we got. They deliver first year of the marriage. right? So it's a good opportunity for me. Then why I should wait the 4th month? I should start right from the preconception. Right from the couple counseling, I should start a program. So we gave a recommendation to Women and Child Department, your program should be shifted. If you don't give in the later stage, fine, but you give it that stage, because that is where we have a social commitment, because that is how we can do it. So now, what we are advocating very strongly, you start your nutrition program right from the adolescent, preconception, and pregnancy and delivery, because at least you can save 62% of the women who are undernourished, or because it is linked with the early childhood development and cognitive skills. Sorry, I'll stop here. Thank you.
Thank you so much, sir. Mona ma'am, over to you. And we'll have 2-3 minutes.
Very brief.
Yes.
Two things that came up in the discussion when they had come. Whenever we are putting in an intervention, like in the scientific thing, even for the AI, when we are looking at it, when you look at the real world evidence, it generally fails. So what has happened is, like, when we are generating the evidence, we really did not give the time to mature. Anything when you are putting, rice fortification is an intervention. So now you have a lot of that real world evidence that is coming in. So you have to now look at the entire gamut of things, create that real world evidence and see where the technology needs to be strengthened, because it's clearly coming up, whatever the intervention has been given in the field, the acceptability is low. So this is coming from our own evidence in the wheat flour plus the salt, because everything requires acceptability and the real-time monitoring and evaluation. Based on what they are saying, it means that the technology needs to be improved. It needs to be seen at what points we have to do it. And even when we are doing the wheat flour fortification, if you actually see, the reason Ambala district, those 2 blocks did really well, although the intervention was same across 5 districts. But it really did well in Ambala because there was a constant monitoring and evaluation. And 2 things, even when we are planning the intervention, the reason we had identified HAFID was because we knew HAFID had a name and acceptability with the people. So the packaging had to be, a lot of thought went in, what is the kind of packaging, what is the acceptability among the people, and who is going to distribute. So all those things need a lot of that thing. So now, since we have already introduced that intervention, I think that we need to just step back see and create that real world evidence, and a lot of scientific studies need to be done. So I think in that sense is like, okay, we have done it. What was in the real world? If the technology is now being done to improve it, maybe you take it up in a more technology like concentrated setups. Take it as like sandboxes. Now I'll use the digital language. So the sandboxes where you test that. If it is performing very well in that, take it in the real world and see how it changes. Then that is how you keep on improving on those things. So with that, I think I'll stop. Thank you.
Thank you so much, ma'am. From here, over to Sahu, sir. You can come. Yeah. Yes.
Thank you so much. At the outset, I would really like to thank the host institute, CFTRI, for hosting us. And I think the last 2 days were really enriching, and also the whole IHRF team in terms of the deliberation that happened right from discussing on the evidence, the program implementation experience, the experience from the ground where we have colleagues from the Food Corporation of India, also listening on other mayors when it comes to dietary diversity, listening on the supplementary nutrition program. I think the last 2 days have been very enriching. I'll not repeat what my fellow delegates have mentioned. I'll just build on a few of these key points, and thank you so much for the deliberation and some of the ground truthing which the colleagues shared here. On awareness, I think very well said it's really important, and as Mr. Mohan, you mentioned, is it has to be right from the ground, and the example of Panchayati Raj Department, and also who are the local influencers, be it religious leaders, be it the film stars or the local influencers. So I think the key opinion leaders become really important, and one is having that basic information, demystifying the myths, And many times we discuss in the conference and we don't talk about what's the real, happening on the ground. So it's really important that ground truthing is very important, and I think this is also helping people who are here from different sectors to take this back at the national level. But I think the key message is getting insights from the ground and then working with the community, both the government systems and also the private sector, to ensure the right messages are going to our consumers. From Madam from, I think, Telangana, there was a request why fortified rice is not available to the open market. So there are many suppliers in the open market as well. So I think that also needs to be communicated well, which has not been communicated. The key point on capacitation, now the Government of India has taken a great initiative to address hidden hunger. We are really talking about big numbers, 40 million metric ton when it comes to rice. We are talking about 500 FRK suppliers. We are talking about 18,000 millers. And all of us know quality is a journey. It will not happen like tomorrow. We know we have a good technology available to fill the missing nutrient need, which is currently in the diet. And capacitation would be really key. And we have a good consortium with these premium institutes like IIT, CFTRI, NIFTIM, and also there is a cohort of state TSUs which are working in different states, and we have in Punjab, Haryana, PGI Chandigarh, we have colleagues from Andhra, so there's Jawaharlal Nehru Technology Institute, NIN is there. So another important key would be that how these local institutes can work with the states or work with the millers to strengthen their capacity, because there was a discussion on capacitating millers and the FRK suppliers. And one key point would also be how we can use ITI institutes. There are a lot of industrial training institute. A lot of FRK millers have also said we train our staff. So I'm talking about from their side. We train our staff, but then again, they'll go to their village, there's a lot of turnover happening. So in the states, because we have quality officers from the FCIs, how the network could also work with ITIs, Industrial Training Institute, in the state, so that these retraining of these FRK and millers is also happening, because then they also struggle that our staff is trained, the government is doing training, but then there's a lot of training. So one key message also, they would be working with local ITIs and KVKs also in building their strength. And the third, I think, as mentioned by Dr. Mona, research, there's a lot of efficacy, effectiveness, so this technology was built overnight. There was 1989, there was Bondante in US who had transferred this technology to an organization called PATH, and then 20 years they worked on it in terms of building evidence, efficacy, effectiveness. There are a lot of other partners joined, like WFP, private partners like DSM joined, and then studies happened on transport condition, pilots happened, and that's how, it matured and the government took a program, that decision. Now, in order to ensure that this technology is being also well kind of transferred to the FRK suppliers, and they are using the technology well in terms of the issues which were identified in terms of the shape, in terms of the density, that capacitation is important, and that's where implementation research, which Dr. Mona was talking about, becomes very key. So the evidence is there, when done with the right quantity, quality, it's there, but the implementation research would really give us insights into what are the implementation challenges across the supply chain, which includes both awareness and which also includes in terms of supply chain issues, and how those could be strengthened, so that with the mandate the Government of India came up with this program, the program is implemented well and it's also showing impact. So I think these were the few pieces I just wanted to highlight.
Yes, there are so many technical questions about the homogeneity, about the blending ratio, about the toxicity of the premix. We at IIT, we have a strong R&D in the rice fortification, and the last 2 years we have been exclusively working on how to detect the micronutrients using kind of real-time kits using, I mean, if you see scale and volume of the, rice being plotted in the PDS system is quite huge. So probably we have demonstrated two techniques today, and of course CFTR, they have, developed one technique. These are the techniques. There are I can say probably they had not been commercialized at the grassroots level, but technology are there. So I will request all of you, those are interested, especially FCI, officials, they can reach to us. And of course, you can find, if somebody said about the blending homogeneity. We have a technology that is, commercialized by IHRF Life Sciences. You can check it, Amazon is available, that, that it is a kind of solution what we do the iron test. That can be used at the platform test when you bring a sample from your premises to the FCI go down. And these are the small techniques we have developed in our lab. Probably after coming year, I can comment it. Coming year, it will introduce the market. Probably we get the proper investor, because you are R&D institutions. We need the investor for commercializing these techniques. So this is one. Second aspect, people are talking about when you take the samples from different, locations of the bag. The problem is that what is the real problem there? Of course, we do a lot of training programs on it. The problem is that if you go this simultaneously blending with the packaging, probably that will avoid your kind of sampling the variation you are getting. Probably if you recommend your millers or blenders, they go with the blenders with the packaging units, like we pack kind of any kind of material. If you have the packaging machine with your blender, probably that will avoid your deviation that you are speaking. And there are so many things, FRK toxicity level, that again, if you see the premix doesn't have a clear-cut standard so far. So there's a kind of limits. Right? But we are working to have a proper standard for the FRK premix. So these are some of the things we have initiated. Probably after some days it will come to the different stack. And again, challenge is that when you talk about rice fortification, there are 3 line departments, and then bringing 3 line departments, it is a very big task. Somebody spoke about that one. If you need to talk to the FCI, you need to talk to DFED, you can talk to the FSI. So that is, of course, one kind of bottlenecks, I can say. Somebody is asking, how to bring out. So that is another issue probably in the whole supply chain. Probably, and as academic institutions, I can say, and there is a need to leverage the higher learning institutions to the local system, as Ruchika said. Local, it may be colleges, it may be department, it may be diploma colleges. They are the ambassador for their belief, because people believe a lot on them. Because if I go from IIT Delhi and speaking to a villager, probably they will not accept me very quickly. So in that way, we are trying to leverage higher learning institutions like CFTRI, IIT Delhi, KGP, based on the regional wise, and they can leverage with their local institutions, so that message will go in a proper way. These are some of the activities we have been initiated in collaboration with different institutions. Of course, I am thankful to CFTRI. They have taken a big lead in strengthening labs, basically. They are doing other activities, but they are doing a great job in strengthening labs, because you understand labs in India, if you see, presence of lab is very poor. And how private sectors are playing with the testing reports, everything. So it's a good approach. We are moving ahead. Probably in coming years, we'll come up with some kind of solutions in this perspective. Thank you so much.
Thank you so much, sir. I think this has been a very intriguing session where, we have discussed a lot, many things, from community awareness to how to bring gender, also how to bring in the health department and their cadres on board for the program, because it's also, we need to link it very strongly with the neural tube defect problem. Then coming to obviously the problems and the challenges that the FCI officials mentioned, and then, how to kind of leverage the local institutes about it, the TSUs that are there, how can they be leveraged, and especially the ITI parts. Completely the technology part, ma'am, as you mentioned, how to make sure that it works in the real world, and how many, we have to really invest in doing implementation research and keep on improving. And as sir mentioned about, the panchayat and the SRLMs part, that is such a thought-provoking thing that, for many of the nutrition programs, we are not right now completely leveraging the points. So I think going forward, we have a long way from here, and a thought-provoking sessions that should keep on happening like this, so that all of us working in this area have the right sort of direction to move. And further, such conferences and workshop will be really helpful, and we'll work towards it. Thank you.
Thank you, Madam and Sirs. Now we have MOU signing between Karnataka Health Promotion Trust and CSIR-CFTRI. May I now request Dr. Sridevi Madam, Director CSIR-CFTRI, and Mr. Mohan HL, CEO KHPT, to come on the dais for MOU signing. I also request Dr. Giridhar Parvatam, Head FSAQCL, Dr. Nandini P. Shetty, Head PMC, Dr. Suresh Sakare, Principal Scientist, Department of FMBCT, Dr. Suresh Sakare, Senior Principal Scientist, Department of FMBCT, to come over the dais. I also request Mrs. Agnita and Dr. Usha Rani Madam to join. I request Dr. Sridevi Madam, CSIR-CFTRI, Mr. Mohan HL, CEO, KHPT, for signing the MOU. Thank you, Madam and Sirs. Thank you, Madam and Sirs.
Yes. Thank you very much. Thank you very much for CFTRI. This is the second MOU we are signing. I think this for us as a KHPT is a great opportunity for us. The science and the program, we call program science, actually coming together. So there's a lot of learning will emerge out of this. Thank you very much, Madam, for this.
Thank you, sir. Now I request Dr. Sridevi Madam to present a memento. Now I request Dr. Sridevi Madam to present a memento to Mr. Mohan HL, CEO, KHPT. Thank you, sirs. Thank you, madam. Now we have reached to the end of the workshop, that is closing remarks and valedictory session. May I now request Mrs. Vanajakshi Madam, Senior Technical Officer, Department of FSAQCL, to take over the session.
A very good afternoon. I welcome the August gathering to the valedictory session of the National Workshop on Initiation and Progress to address the hidden Anga. May I request the dignitaries to kindly come over to the dais. Dr. Sridevi Annapurna Singh, Director, CSIR-CFTRI, Professor Jatendra K. Sahu, IIT Delhi, Dr. Sumit Arora, Principal Scientist, ICAR, Dr. Mona Dugal, Director, ICMR, NIRDHDS, to come out to the dais and occupy the chair. May I request Dr. Giridhar Parvatam, Head FS&A QCL, to accompany the dignitaries to the dais. May I request Ajay Kera sir to kindly join. Thank you, sir and madam. May I request Dr. Giridhar Parvatam, Head FS&A QCL, CSIR-CFTRI, to give the overall proceedings. Sir, please.
Good afternoon to all, or good afternoon to all. Oh, good. That's still our energy levels are good. Okay. I welcome you all for this closing function of this 1.5 day national workshop. So I hope you all agree that the deliberations, the discussions happened during this entire workshop are highly informative and also useful. During this 1.5 day workshop, we had a conglomeration of talks and deliberations and discussions from policymakers, field level implementers, and also the scientists behind in the fortified food products. I hope these proceedings, whatever happened, are really interesting. In fact, a couple of students are instrumental in drafting the entire proceedings. Highly meticulously, they wrote 3 pages, but due to paucity of time, I'm not able to read that one. But if they are here, I request them to stand up. No? Okay. But nevertheless, the echo will reach to them. Give them big round of applause. Really meticulously they wrote it. I will share those proceeding minutes to you. Fantastically they wrote it. So I identified 2 persons who can write very good review articles. Thank you very much. So during this entire 1.5 day program, we have 6 technical sessions and 2 theme talks. During these 6 technical sessions, 14 invited talks, 10 panelists also participated in this one. So that is just a brief I will give you. I don't want to read the entire things because we have more or less everything is covered during the panel discussion, especially Dr. Ajay sir has given fantastic sum up of many of these events covering all these aspects. So I don't want to go to repeat for that one. For most of you, the information and invitations were sent just a few days back. Despite this, we received very good response from you all, and the CFTRI is really very much delighted to host you, all of you here during this 1.5 day program with your presence. Thank you very much to all of you for responding to our call and making this function, really this entire workshop as a successful thing. I hope the invited talks, demos given might have given a really what is called curiosity, because Dr. Gulfam was telling curiosity triggers collaboration. Nevertheless, it also helps students, especially students, the community, to pursue their food science and technology in future also. So we have a very good number of young people, students from local colleges, both graduation and post-graduation students, they are present here. And they very patiently participate. I mean, they are in the hall for the past 1.5 days. I hope whatever things discussed and presented here, you might have got a lot of interest and curiosity, because daily from dawn to dusk in your day-to-day life, at one or other point in any product, you might have seen the fortified products labels and other things. Now you might have understood the weight and might behind those labels. So I hope you all might have enjoyed. I request the first 4 rows delegates, please give a big round of applause to the back. Thank you very much. More than that, I don't want to say, because a very good Vanajakshi to continue this. Yeah.
Thank you, sir, for sharing your remarks. May I now request Professor Jitendra K. Sahu, sir, to kindly give his remarks. Sir, please.
Very good afternoon. So, respected Dr. Singh, Director CFTRI, Dr. Mona, Director ICMR, Dr. Arora, Dr. Giridhar, Dr. Khera. So, actually, this was planned very quickly. I thank my PMU team, the project management team, and everything happened very so fast. So, and for that, I also congratulate and thank CFTRI whole team, of course, the director and the whole scientific team, for organizing this program at CFTRI. Of course, we planned very early, but anyway, it did not happen. So this point is that, you know, this any kind of fortification program, it is a very complex subject. So, you know, the whole stack system, there are a lot of, you know, stakeholders involved in the whole process. So last 2 days, we have seen the presentation from different angles. Somebody spoke in policy perspective, somebody spoke in technology perspective, somebody, of course, Dr. Khera enlightened how the women, you know, come into the picture of this fortification system. And it was very enriching, and I found so many students coming to this program, which is a good news for us that it is the fortification program is going to be accepted by the different consumers. As I told yesterday, the final goal is how to improve the consumers for this kind of programs, any kind of vehicle we are putting into the market. So, so therefore, from IITD, so we are the co-host for the program. We thankful everybody participated in the program. Especially, I'm very thankful to the director CFTRI and their whole team, coordinated by Dr. Giridhar. And we are looking forward for such programs in future in this region, because we are focusing, you know, there is a, you know, regional disparity as well, because we organize programs at Delhi, but we are coming to south. It is a good part is that we are trying to leverage, you know, CFTRI. Probably in future we'll go some other part to speak and advocate this rice fortification program as a country. Thank you so much.
Thank you, sir. May I now request Dr. Sumit Arora, sir, to kindly give his remarks. Sir, please.
Thank you all. It's my pleasure to be here, and thank you all for inviting me over. It's my first visit to the CFTRI, and It's a very, very pleasant experience. I would probably be a Koop Manduk, a frog in the well, if I would not have come here. See, my experience was limited to milk fortification, but I had now exposure both to rice fortification and wheat fortification and the methods to determine them. So I have been enriched. I hope you too would have been enriched to a certain extent. Thank you all. Thanks.
Thank you, sir. May I now request Dr. Mona Dugal Madam to kindly give her final remarks.
I think thank you to all of you, and especially Dr. Sahu for organizing it here in a lovely, beautiful institute. I think I would have actually skipped, but had it not been for Dr. Reena. She was like, we have to go to Mysore, we haven't seen it. I was like, I was debating in between because I had quite a few engagements. But thanks for bringing us all here. I think it has been an eye-opener, as Dr. Sumit rightly pointed out. And I think it is a matter of time. I think we take this program across India. And I think a good team has been built. And if we are able to take it across and spread the message and build this evidence, I think that this would be something of a starting point. Congratulations, and thank you once again.
Thank you, madams. CSIR-CFTRI have been fortunate to have you all here for this program. May I now request Ajay Kera sir to give his remarks, please.
Yeah, dear dignitaries on the dais, the director of the CFTRI and the participant of this particular 2 days workshop, I will really like to take this opportunity of, congratulating both the organization, Innovation Hub for Rice Fortification at IIT Delhi and CFTRI Mysuru for fantastically, organizing. And I will certainly call it a very meticulously kind of, organized 2 days workshop. And it was a great learning experience. And many, many congratulations for active participation of each and everyone. And thank you very much.
Thank you, sir. May I now request Madam Sridevi Annapurna Singh, Director CSIR-CFTRI, who is the driving force for the entire program, to give her remarks. Madam, please.
Very good afternoon to all. And I don't know what to say because all the other speakers have said. And unfortunately, I missed most part because we have some recruitments going on and I had to oversee that. Nevertheless, I think it's one of the most important workshops, and I'm very happy that we are paying attention to it, and we require many, many stakeholders. I think throughout the workshop, it has been highlighted how complex a problem is this, hidden hunger. So it cannot be one person or one institute who can find solutions, but many stakeholders have to come together. While it has started and it is going to pick up speed, I am sure, but it would also take time given the largeness of our country, how huge it is, and the complexity with terms of whether it is raw materials, whether it is geographical location, and so on. So I hope that it will be sooner rather than later. But having said that, I'm sure all the youngsters who are sitting behind, I do not know why, but I also used to sit there. Now I'm forced to stand here and speak. So I'm sure you will be inspired. And please remember that all of you are extremely lucky. You are healthy, you're normal. That's why you're able to sit here this long, even past lunchtime, and hear the experts speak. So let us also do the same, that our compatriots also are able to come out of undernutrition and hidden hunger, and they will be able to also participate and give their best for the development of our country. I also wish to place on record my appreciation and thanks for the very, very busy experts who have come here. They have been kind enough to accept our invitation. Actually, Mysuru is just a little bit off. I have traveled quite a bit to Delhi, and it is the Bangalore to Mysuru which really tires me out, especially when I'm returning. So I do realize how difficult it is to reach Mysuru, but I'm also happy to hear that you all are not disappointed and you go back with good memories. History is a witness that CFTRI has always been forthcoming wherever it has been required in our area of expertise, and we will continue to do so. Just a call away or an email away, which is instantaneous today, and we will be part of it. We continue our service for the nation 75 years onwards, and we hope that together all of us will be able to work towards this really great cause. I know that all of you want to fortify your stomachs with food now and don't want to hear me. So I'll stop here. Once again, thank you, and special thanks to my CFTRI colleagues. I have not seen this, if I'm very honest. On a Saturday, if we arrange a seminar, nobody comes. But look at the hall, it is full. So I'm sure all of us realize how important it was, and thank you all once again. Let us do our bit for our country. Thank you.
Thank you, madam. We are all here because of the BMGF funded IHRF project. Director, CSIR-CFTRI, Dr. Sridevi Annapurna Singh is instrumental and took a proactive step to join this IHRF project. Dr. Jaideep, the former head of FSAQCL, took initiative and gave a good kickoff with a training program. Subsequently to his superannuation, from the past 18 months, Dr. Giridhar Parvatam is at the helm of the affairs along with his colleagues, under the guidance of Dr. Sridevi Madam, in running this program. Madam is officially superannuating in the end of this month, so the mantle of principal investigator has been transformed to Dr. Giridhar sir. Since with more than 3.5 decades of service of Madam Sridevi Annapurna Singh to CFTRI, and recognizing Madam's passion towards alleviating anemia, malnourishment, and also in guiding CFTRI, along with this IHRF program, we deem it an honor, Madam, to felicitate you on this occasion. May I request the dignitaries to join the felicitation. I request Ms. Ruchika Sachdev to kindly join the dignitaries.
This is very important. Nobody felicitates in one's home. Should have invited sir for this, yeah.
Thank you, madam, for accepting the felicitation, and I thank all the dignitaries on the dais for doing the honors. We appreciate the teams who have given the demonstrations of their testing analytical kits. As a token of appreciation, we would like to request the following teams to come out to the dais and accept the memento. Dr. Sindhu Nambiar. Please come over to accept the memento. I request the dignitaries to do the honors. May I now request the students of IIT Delhi to kindly come out to the dais and accept the memento. Dr. Suresh Sakare and team kindly come out of the dais to accept a memento as a token of appreciation. Thank you, sir. I request Ms. Amriteshwari to kindly accept the memento as a token of appreciation for her excellent comparing. Thank you, sir and madam, for doing the felicitation. Madam and sir, kindly, I request you to take your chair. As we come to the end of this national workshop, I request Dr. Prasanna Vasu, Senior Principal Scientist, CSIR-CFTRI, to wrap up the event with vote of thanks. Dr. Prasanna, please.
Distinguished delegates on the dais and off the dais, my dear colleagues and student delegates, good afternoon to all. I deem it a great honor and privilege to be here to extend the vote of thanks on this memorable occasion of the two-day national workshop on initiatives and progress to address hidden hunger. First of all, it is my pleasure to thank our director, Dr. Sridevi Annapurna Singh, for her presidential address and for delivering the theme talk on the efforts on processing of food to address undernutrition in children and setting the theme of the workshop. Thank you, madam, for your continuous guidance and effort. I extend my deep gratitude to Dr. B. Sachikeran, former director, NIN ICMR, for being the chief guest of this workshop and delivering the keynote address. I thank sir also. It is my privilege to thank Dr. Ajay Kumar Khera, former Commissioner, Maternal and Child Health, Government of India, and country representative, Engender Health, New Delhi, for being the guest of eminence and delivering a technical talk on integrating gender in nutrition. Thank you, sir. I sincerely thank Professor Reena Das, head of the Department of Hematology, PGI MER, Chandigarh, for being the guest of eminence and delivering the traditional technical talk on fortification of iron, vitamin B9, B12, on salt, rice, wheat, and so on. Thank you so much, ma'am. My special thanks to Professor Jatendra K. Sahu, IHRK Program Coordinator, IIT Delhi, for his contributions to this program, as well as coordinating the IHRK activities, and also for the welcome address. Thank you so much, sir. My heartfelt thanks to Dr. Giridhar P., Head of the Department, FSAQCL, for welcome address, as well as for guidance and support throughout this workshop and making it a big success. Thank you, sir. I also thank Dr. Sumit Arora, Principal Scientist, ICAR NDRI Kernel, for being here and giving a technical talk on fortification, as well as especially on iron, double fortification of salt, basically. Thank you, sir. I take this opportunity to thank all the eminent speakers, like Professor Prashant Tankachan, St. John's Research Institute, Bangalore, Professor Hari Prasad P., Environment Biotechnology, IIT Delhi, Dr. Yuvraj Bosale, Program Manager, IIT Kharagpur, which joined online, Ms. Sonal G. Jain, Program Manager, NIFTEM Kundli, Dr. Mona Dugal, Director, ICMR, NIRDHDS, Mr. Adil Abbas, Associate Director, PCI India, who joined online, Dr. Siddharth Vogelkar from World Food Program, Mr. Mohan HL, CEO, KHPT. And also, I thank all the delegates who have participated in the panel discussion, especially Dr. Rajan Kumar, Deputy General Manager, Telangana State, Mr. Amit K. Agarwal, Food Fortification Officer, National International MP, Dr. Manmohan Singh, Manager, Health and Nutrition, MSc, and Dr. Shruti Arora, Program Associate, PATH, and also Ms. Ruchika Sachdev, India Nutrition Lead, Bill and Melinda Gates Foundation. So please join me with a big round of applause to all the eminent speakers who have contributed for this program. Thank you. So I have to acknowledge all the delegates from Bill Gates, IIT Delhi, IHRF, especially Dr. Gulfam Hasmi, delegates from KHPT, PATH, World Food Program, FIXI, and also the trainees from Andhra Pradesh, Telangana, Tamil Nadu, Karnataka State, as well as from Andaman Nicobar. And also, finally, I thank my committee members, all the committee members, especially the stage committee, registration committee, technical committees, food and transport committees, and Ms. Pooja for her invocation, and Ms. Amriteshwari for nice comparing of this workshop, throughout the workshop, as well as comparing the technical session, especially Ms. Priyanka Bajaj, Dr. Devendra Havre, and Reddy. And also, all the thanks goes to the PMC, UNU, TTBD, IT department, INP department, electrical department, civil and maintenance department, security, Agri and HOT for their support throughout this program. Finally, I thank you all for this wonderful event, making it a big success. So please rise for the national anthem.
I request all of you to join for the lunch arranged at IFTTC Hall. Also, I request the participants who have not collected their certificates to collect in the registration desk. Thank you all.